The broadcast is now starting. All attendees are in listen-only mode.
I'm sorry, I was on mute. Let me start again. Welcome everybody to Election Day and Lane County Board of Commissioners meeting for November 3rd, 2020. I'm going to read in our regular introduction for people that are watching, and then we're going to move into our Board of Public Health meeting before we get into our regular Lane County Board of Commissioners meeting. And this is a morning meeting only. We will just move through the agenda until we get through it all. Hopefully we'll get out timely for noon lunch, but until we're done, we'll just move through it and we won't have an afternoon meeting today. So I'm going to read through the introduction now. For the public that's watching the meeting, when you're registered for the meeting, you're registered in our system as attendees. Attendees are webinar participants, simply viewers of the meeting. The microphone and the webcam for you are automatically muted. However, when there is the time in the meeting for public comment, you may participate in public comment by raising your virtual hand, and you should see a hand icon on your device. Just check it once, and I will turn it over to our moderator who will call names. You, when your 3 minutes is up, you'll be automatically muted again, and you can stay on and watch this webinar as long as you choose. We'll try to give everyone who wishes to speak time to speak, but please note in the event that there are more people wishing to speak than time allows, we may need to limit speakers or the time allotted, or choose speakers randomly. And we haven't had to do that, hopefully not today as well. So with that, I'm going to open our Board of Public Health meeting and ask if there are any adjustments to the agenda. Hearing none, is there any emergency business this morning? Okay, seeing none, we'll move straight into our report of Public Health, our semi-annual Board of Health report specifically. And with us is Karen Gaffney, our Director of Health and Human Services. And it looks like you have several other people with you if you'd like to introduce your additional guests. Thank you.
Thank you, Chair Buck and Commissioners. And actually for this item, I'm going to turn my camera off and hang out in the background. With you today for the report is Dr. Jocelyn Warren, our Public Health Manager, Dr. Pat Ledke, our Senior Health Officer, and Jennifer Webster. And I think if I turn off my camera, she can probably come up as well. And they will do the report on the semi-annual Board of Health, and I will be here in case there are questions about all of those attachments to the report that include the rest of Health and Human Services. As always, we think about health in the broadest sense of the word. So this is in many ways an update on the entire Department of Health and Human Services. But our focus this morning is very much on our public health work. So I'm going to turn it over to Jocelyn. Thank you.
Thank you, Karen. Thank you, Chair Buck and Commissioners, for inviting us here today. This is our semi-annual Board of Health. Today, Jennifer Webster will present the findings from the new Community Health Assessment. The exciting thing about the Community Health Assessment is that it is now available online using the Tableau platform. So as you know, we have adopted Tableau as a Health and Human Services department, and that has been more widely adopted also throughout the county. And now we are able to use it and share our community health assessment data, which is quite an advance for us, I think, from an innovation perspective. But before turning to the CHA, Dr. Pat will take a few minutes to provide an update on COVID-19 vaccination planning, which I'm sure many people are eager to hear about. Dr. Pat.
And Chair Buck and Commissioners, thank you so much for this opportunity. It's going to be a bit of a quick speed dating around the logistics of COVID vaccine. And I don't see slides on my screen. I'm not sure if you can see our slides. Chair Buck, can you see that?
No, we have our regular agenda and timer up at the moment.
Okay.
Jennifer, are you with us?
I am here, but I'm here, but I don't have the option to share my screen at the moment.
Jennifer, this is Diana Jones. I did not know you were going to share slides, so I will make you the presenter right now.
Thank you, Diana.
In the interest of time, I can just talk, so I will do that to save time. So it's interesting. There are roughly 200 vaccines in trial across this planet, which is really an amazing outpouring of science. We sure wish we would have 200 vaccines for tuberculosis or HIV or any number of other infectious agents. But suffice it to say, there's a lot of work across the planet to make sure that there's vaccines produced that are safe and effective. The United States government has a handful of contracts with some of the largest producers. I suspect many of you have heard of Moderna and Pfizer. USG also has contracts with Novavax, AstraZeneca. So the goal is to purchase 50 million, 100 million doses from each of these companies, and hopefully 1 or 2 or 3 of them will meet the safety criteria of vaccine trials and the efficacy criteria, and they will come to market. So our federal government is really hedging its bets with contracts with several different producers. We have a vaccine plan in place right now. The person leading it is someone you know well, Cindy Morgan. Cindy was our communicable disease nursing supervisor. I think many of you know, still makes me laugh. Her quote when she retired in August was, 42 years in public health is enough. But of course, she's back now leading our vaccine effort for COVID. So maybe 42 years in public health is not enough. At any rate, what our expectations are really are as follows. There will be a trickle of vaccines coming out towards the end of the year. We suspect that one of those manufacturers, Novavax, AstraZeneca, Oxford, Moderna, Pfizer, will meet safety and efficacy criteria, and a small amount of vaccine will be trickling out towards the end of the year, but then much larger production in the first quarter and second quarter of next year. And we will need to prioritize the production, or the use of those vaccines as we move forward, as the pipeline becomes filled with vaccine. Next slide, please. Thankfully, we are able to prioritize that based on some of our past experiences. So we have had vaccine shortages before. We've had new pandemic viruses before, and we use protocols to prioritize who will get the vaccine first. So the most recent was 2009 with the H1N1 influenza pandemic. We had a pandemic vaccine, and we prioritized groups according to a model put forth by then the Institute of Medicine, which has since been renamed the National Academy of Medicine. And this is the protocol between NAM, National Academy of Medicine, and the Center for Disease Control. So there are 4 phases. And the first phase, essentially people who are really on the front lines, and they are at high risk. And you can see that under the first phase, which is something we are calling the, I can't read it myself, but I think it's the jumpstart phase. That's 1A, and then 1B is other persons who meet that high risk and essential worker, first responder type of group. Into phase 2 are other persons who are at high risk, and some people who are at moderate risk. We don't get to kids until phase 3, and most likely that will be late in the second quarter, April, May, June of 2021. And then finally phase 4, as the pipeline is fully filled with vaccine, we'll get to all the rest of the people in this country. Now, there are a few things to know about this. Most of the vaccine candidates are 2 doses. So next slide, please. A couple of the vaccine candidates are 2 doses, 28 days apart. A couple of the vaccine candidates are 21 days apart. There's only one production vaccine right now that we hope makes it through phase 3 trials and gets approved. That's a single dose. That's the Johnson & Johnson vaccine. But again, they're all in phase 3 trials, and no one knows which one are going to make it through. So we do need to track and make sure that people who get the first dose of one vaccine get the second dose of the same vaccine, because they are not interchangeable. And certainly not all of our pharmacies, not all of our doctors' offices are going to stock all 6 or 7 or 8 of the vaccines that make it to market. They will focus on a couple of them. So that's something we need to keep in mind, and Cindy Morgan and the team are working hard on that. Another interesting logistical issue is the unique storage requirements. Because of this Operation Warp Speed, we have been working, or the vaccine manufacturers have been working, at warp speed to try to make sure that these vaccines get to market fast. And when you are working on that, you are not spending as much time on vaccine stabilization studies. Does the vaccine need to be stored at room temperature, at refrigerator temperature, at typical freezer temperature, or at hyper cold? One of the vaccine candidates at present needs to be stored at -70 degrees. That is not part of our typical vaccine logistical system right now. So many of us are looking at how we're going to deal with that. We are hopeful that further stabilization studies will happen, and maybe they can get that temperature down to, say, 0 degrees, a typical home freezer temperature, which is much easier to attain. So we are working through those logistics. And I wanted to finish with just a view 12 months from now. I'm not convinced that my crystal ball is better than anybody else's, but it's worth taking a look at what we think might happen. And we will have, again, I think, a trickle of vaccine come the end of this year, towards the end of December. We will get more in the first quarter, January, February, March, and there'll be literally a flood in the second quarter from various manufacturers. And we, of course, are going to work hard to make sure that we as a community take advantage of that vaccine, get as many people interested and choosing to take the vaccine as possible. But we will not build up herd immunity quickly enough to say we're going to open up the entire community because we are now safe for some time. So most likely we won't have significant immunity for about a year, which would take us to November 1st of next year before we feel as though there is a significant amount of immunity, and perhaps we don't have to worry so much about things like social distancing and masks, etc. So I'm going to stop there. Happy to take questions or just move right into Jennifer. Jocelyn, what's your pleasure?
We need your audio.
I'm sorry. Chair Buck, I'm happy to do questions now for Dr. Pat, if that works.
Any questions for Dr. Pat today? Well, let's continue on then, and it may come up here next. We'll see.
Great. Okay, thank you. So next we're going to turn to Jennifer Webster, who is our community health epidemiologist and leads the community health assessment and our community health improvement planning work for the county. And she's going to talk through the new community health assessment. Jennifer?
Thank you. Good morning. As Jocelyn said, I'm Jennifer Webster. I am an epidemiologist in the prevention section of public health, and I'm really pleased to be here to be sharing the results of our most recent community health assessment, and as well as the progress towards our new community health improvement plan. As you know, conducting a comprehensive assessment on the health of the county, like Lane, is an enormous undertaking, and using that assessment to craft a community-wide improvement plan, essentially a strategic plan for improving the health of the community, is even larger. And for this reason, Lane County Public Health partners with several countywide organizations to do this work. Our collaborative was branded Live Healthy Lane upon completion of the 2016-19 CHIP, and includes participation from organizations that also have obligations to complete a community health assessment. And we use the MAP, or Mobilizing for Action Through Planning and Partnership framework, for conducting our assessments and developing the plan. MAP is a nationally recognized framework that, in addition to having a strong focus on community engagement, meets accreditation standards for public health. MAP outlines 4 major assessments for understanding the health of the community, and I'm going to provide a brief summary today for each of those. The first is the community themes and strengths, which answers the question of what's important to the quality of life and good health in our community, and what assets do we have as a community to support health. The local public health system assessment answers the question of what activities and competencies and capacities of our local public health system. And note that this is a system of the multiple systems involved in providing the 10 essential public health services, and not just focused on the county health department. The forces of change assessment, which asks the question, what is occurring or might occur that impacts health or the public health system, and what specific threats or opportunities might be generated by these occurrences. And then finally, the community health status assessment asks the question, how healthy is our community? And then, as Jocelyn mentioned, because one of the findings in our assessment was disparities in health outcomes and in the social determinants of health, we conducted an additional assessment on health equity, which can now also serve as an update to the 2017 Health Equity Report. This report goes deeper into several of the indicators and health outcomes, health behaviors, and the social determinants of health in order to have a more complete picture of what inequities exist in Lane County. So I'm going to start with community themes and strengths. Because we did such a robust assessment in 2015, our updated assessment really focused on reaching communities that may have been underrepresented in that assessment and asking about progress on the current CHIP priorities. Our assessment included focus groups with youth, rural communities, Spanish-speaking communities, and a survey that got 590 responses from a diverse cross-section of community members. Both focus groups and survey respondents were asked about their perceptions on progress made on the CHIP priorities since 2016, and if there are any additional issues that should be prioritized. As you can see in this graph of survey responses, a majority of people feel that things have stayed the same or gotten worse, with the exception of efforts to promote healthy behaviors, though it's worthy to note that the wording of this question asked about efforts to promote health behaviors rather than changing behaviors, unlike the other questions. So from this survey, we learned, in the focus groups, we learned that access to living wage jobs, affordable housing, affordable healthcare, affordable childcare, and access to affordable healthy food remain priorities for our community, as well as the need to promote healthy behaviors and access to dental care. Racism and discrimination was one of the areas that the community indicated should be a priority moving forward. Participants were also asked about strengths and assets of Lane County as a community, and they identified collaboration, policy work, and a general understanding of the social determinants of health as assets for continuing to improve health. To assess the local public health system, key stakeholders, including hospitals, primary care providers, insurance plans, and others, met in August of 2018 to assess the community's performance on 4 of the 10 essential public health services that showed the need of improvement in our 2015 assessment. And as you can see here, the system in these 4 areas have all progressed to needing minor improvement, with one area developing policies and plans moving into the optimal or needing no improvement range. In addition, the following areas of focus were identified as priorities: effective and appropriate data sharing and communication about the broad and integral nature of public health, engagement with community partners, particularly the business community, to better integrate and understand one another's contributions to community well-being, communicating with and engaging the community to increase understanding of housing as a public health issue and the importance of addressing mental health needs as a piece of improving access to housing, and a continued focus on health promotion and health education. And as you know, many of these areas have also been highlighted as needs in our COVID response. The Forces of Change assessment brings together a broad cross-section of leaders in the community for a facilitated conversation on the threats and opportunities that exist in the context of Lane County and beyond that could impact the work of improving health. While a global pandemic was not part of the discussion back in 2018, it is clear that these forces that were identified during that conversation are having an impact during our response. And some of the threats identified include deep racism, increasing homelessness, social isolation, immigration policies, cuts to the social and safety net, immigrants' fear of accessing services, and increases in hate crimes and/or discrimination. Opportunities that were identified were engaging more with community-based organizations, supportive housing, more innovative funding, more local control, telemedicine, more policy advocacy, and strengthening cultural competence. The Community Health Status Assessment pulls together secondary data from multiple sources to paint a picture of the community's overall health and the social conditions that drive health. Overall, Lane County remains a moderately healthy community with a well-educated and active residents. However, there are several health conditions and social determinants of health that vary dramatically based on race and ethnicity and geography. These create significant inequities in health and in the conditions necessary to create health. Some of the key findings in the community health status assessment include rates of chronic disease have remained stable over the last few years, but rates of STIs are continuing to increase. Lane County continues to struggle with economic recovery from the 2008 recession, and the pandemic is likely to exacerbate this, with 20% of the population living in poverty and 40% experiencing a housing cost burden, which is paying over 30% of income to housing costs. Lane County residents use tobacco, alcohol, and marijuana at higher rates than the rest of the state. High school graduation rates are lower in Lane County compared to the rest of the state. And there is a troubling trend of decreasing mental health, especially among youth in Lane County, as shown here in this graph. And as I mentioned, due to the findings of disparities in the community health assessment, and because the 2017 Health Equity Report was due for an update, we also conducted an assessment of disparities across race, ethnicity, and disability status. Data was again compiled from secondary sources that could be disaggregated by race and disability status for health outcomes, health behaviors, and the social determinants of health. And unsurprisingly, the report revealed inequities in health outcomes, health behaviors, and the social determinants of health along racial, ethnic lines and by disability status. Putting together the report also revealed that there are significant gaps in the data, as not all data can be disaggregated by race and ethnicity due to methods of data collection, small sample sizes, or a combination of those two factors, which highlights the need for a more robust data collection and sampling methods so that we can obtain a more accurate picture of the experiences of Black, Indigenous people of color across Lane County. We also need more data on community resilience and the strengths and assets of Black, Indigenous people of color communities. It is not enough to tell the story of the struggles and the results of a racist history and racist policies, but we need to tell the story of strength and striving in these communities. So I'm just going to walk through a few data points to illustrate how our history of racism has created conditions that result in health inequities for just one area of health. So you see here that every racial ethnic category has experienced higher rates of poverty in the last 12 months when compared to the white non-Hispanic population of Lane County. Higher rates of poverty are direct results of limited access to opportunity based on race ethnicity that stem from the systemic oppression of people based on their racial appearance. Everything from deed covenants that prohibit home sales to bias in hiring practices contribute to the conditions that create poverty at higher rates in certain populations. And children experiencing poverty often have a harder time concentrating, experience greater absenteeism, which can then lead to lower academic performance. We also know from state data that children identified as Native American, Black, and Latinx are disciplined at much higher rates than white children, a direct result of implicit bias, which also contributes to lower academic achievement. And here we see that students in several racial ethnic groups have lower on-time graduation rates compared to white students. And it is also worth noting that academic achievement is one of the strongest predictors of health across the lifespan. Poverty is a known contributor to trauma, and many people who experience trauma develop coping mechanisms that are not good for their health, such as tobacco use, alcohol use, and use of other drugs. It is also known that people experiencing discrimination based on race contribute to a generational trauma for people of Black, Indigenous, or other people of color. And here we can see that people identify as Black or Native American have the highest rates of daily tobacco use in Lane County, as well as higher rates of tobacco use during pregnancy. So it should come as no surprise that Native American Black communities also have higher rates of tobacco-related deaths compared to other races and ethnicities. And this brief example illustrates, and there are many others in the report, that our history of racism and racist policies continue to create conditions of inequitable access to health and to the conditions needed to achieve good health. These inequities are structural and systemic in nature and will require structural and systemic strategies to address them. Which brings us to the overall findings and the development of the Community Health Improvement Plan. So there are 4 themes that emerged from the analysis of our 4 assessments. A significant proportion of Lane County residents lack access to affordable housing, living wage jobs, healthy food, and quality childcare, all of which are key social determinants of health. There are significant disparities in both health outcomes and the social determinants of health in Lane County based on race and ethnicity. There is a concerning trend of worsening mental health among Lane County residents, especially youth. And the above conditions stem from and contribute to environmental conditions that are detrimental to healthy behaviors and health outcomes for Lane County. So the 4 themes that we identified went through an extensive root cause analysis and a community engagement process to identify 3 strategic issues. Ensure incomes are sufficient to make basic cost of living. Establish community conditions that support behavioral health and physical well-being, and address current and historical injustices that produce disparities. Through conversations with more than 21 community partners, community coalitions, community advisory groups, we identified one overarching goal because we noted that the strategic issues were all interrelated with each other, and that is to create the community conditions necessary to promote behavioral health and physical wellness across the lifespan for all people in Lane County. As part of that process, we crafted 4 areas of strategic focus. Support economic development that ensures sufficient income and affordability of basic living costs. Transform current institutions, policies, and resource allocations that perpetuate racism in order to correct current and historical injustices and ensure equity in the future. Ensure systems of care address the health needs of the whole person and are accessible across the lifespan. And implement a community and organizational policies that support healthy choices and mental well-being. And this is the foundation upon which we will be building the Community Health Improvement Plan. So the Live Healthy Lane core team is currently working on the final phases of CHIP development. Currently, we are wrapping up the determining actions. Actions are the collective impact approaches that will direct the community's focus for the duration of the CHIP. They are identified through engaging community partners and key stakeholders in conversations about what has worked in the past, how we can move the needle on the strategic priorities, and by looking at evidence-based approaches for each strategy. And we are currently in the process of identifying and wrapping those up. Next, we'll be setting population outcome measures. These are indicators that will help quantify progress on the CHIP strategies. They will be identified for each strategy by an evaluation and tracking team that is composed of community members and partner organization representatives. And we have our first meeting next week, so very excited to get that going. And then once we have that, we will draft the CHIP and get approval from the partner organizations. So we are on target, I think, to complete the draft by late December, and hopefully we'll be presenting and have formal adoption in January. And then once the CHIP is adopted, we will begin the action cycle or the final phase of the MAP process, which includes determining immediate objectives or short to medium term outcomes for each action and developing implementation steps to achieve those outcomes, including the who and by when for each activity. And this will be, again, coordinated by the core team and involve engagement with key stakeholders. And that concludes my presentation, and I am happy to take any questions.
Commissioner Farr.
Chair Buck, I first have a request for another look at a slide. Jennifer, can you bring up the slide that shows the result of the survey? Is maybe the 3rd or 4th slide in?
That one?
No, a little further forward. The one that shows the result of this survey that was responded to by 580 people.
Is it up?
The first graph.
Because it's showing that it's up on my
maybe
screen.
slide number 4. There it is, right there. That's the one. Thank you. So the number 1 on there is, I'm going to read this out loud, ability to get affordable housing. 91% of the people responded that it's gotten worse. 91%. That overshadows everything else. Chair Buck, I'm not going to say anything more than that right now, but I'd like to get back in the queue for later. Housing is the issue, and I just barely see housing in our CHIP. I see it as a kind of a byline in economic strength, which is of course an important element, but housing causes all the other things to be easier. It causes childcare to be easier, causes access to food to be easier, and conversely causes all of those, everything to be more difficult if we don't have adequate housing. Clearly 91% of the people surveyed agree with me on that we have a problem with housing, and it just barely is mentioned in the CHIP. We can talk more about that. Thank you, Chair Buck. And hold on just 1 second. I need to grab a picture of that. Okay, thank you, Jennifer.
Important point. Any other questions or comments? Okay. Commissioner Bray.
Thank you. I have so many comments. I don't even know where to start. I mean, this is such a huge subject. I personally am so attached to this notion of community health, Jennifer. I've not seen a vision of what would Lane County look like. What's the goal here? How will we know if we have a healthy community? What are we shooting for?
Jennifer, you're on mute, I think.
I could answer that,
sorry.
but I'm going to mute.
You can defer to
that's
Commissioner
it.
Farr if you'd like.
That's a great question. Actually, we do have a vision statement, and I don't have it in front of me. We actually developed that vision statement as part of our 2016-19 Community Health Improvement Plan. And so that vision is going to carry forward. And unfortunately, I don't have it in front of me, but it will be when, we see the community as having health, and health is equitably distributed across the community. That's my kind of rough translation based on my memory.
So thank you. And I'm not meaning to put you on the spot. As I look at this, it looks to me like if everyone had a job where they could support themselves, and if everyone had access to childcare, which I presume is much more of an issue now than when a lot of those discussions took place. As Commissioner Farr said, when housing and shelter, which is in safe neighborhoods and et cetera, is available to everyone, all of these things to me are pointing to economic kinds of things, and I don't see the connection yet between the vision of where we want to be and the activities, and forgive me, I'm sure this exists, but the activities of our healthcare community, other than keeping people as healthy as possible within resource constraints, until we can get to a world where these issues are beginning to be addressed. Am I missing something here?
I would be happy to start with that one, and Jennifer, you can, and Dr. Pat, if you'd like to address that too. I think the basis of this plan is at the core of this, we understand that healthcare accounts for a small percentage of the things that actually make a community healthy. And when we talk about social determinants of health, we're talking about those other things that contribute to health in such a meaningful way. And that's really what the public health focus is here. And that's how we distinguish ourselves from medical care. Medical care is an expense, and health is an investment. And these are the things that we do in our community to ensure that the environment is one in which people can make healthy decisions and have the opportunity to be healthy. It includes access to care, but that's just one small piece of those things.
Well, yes, I agree. I'm just trying to see where the rubber hits the road here. One last thing, Chair Buck, and then I will relinquish the floor. I hear in so many areas the term systemic racism, and I would like to incorporate into that discussion at least my perception of what that means, because I don't hear people talk about it. I hear people talk about the results of systemic racism. When you don't have living wage, full employment opportunities, we create mechanisms of excluding people because we don't have enough to go around. Those mechanisms of exclusion include university education, getting credentials for being able to even teach high school, for example, various certifications. Those become mechanisms of exclusion. When we look at who tends to be excluded through all of this data, and if in fact those excluded are disproportionately of different races, then we talk about institutional racism. And I would like us to understand that so much of this begins, it's economic and it's educational. And when I heard Jennifer, I believe, discuss that the graduation rate is declining in Lane County, I think with what's going on now with schools, we are losing the engagement of so many people that will only show, young people, that, like my grandchildren, that will only show up in data. I am so concerned with this. And I would like to share to the public health community that as we attempt as commissioners to do what we can, we did just pass a community benefits thing, which actually addresses not all, but a lot of these areas as it relates to investing dollars so more people have living wage jobs in our community, more people of color and women and veterans have access to apprenticeship and other programs, et cetera, et cetera. So everything really is related to everything else. And thank you for allowing me so much time, Jim.
Any other questions or comments? Commissioner Bozovich.
Thank you. And I just, like Commissioner Farr, I was astounded by that 91% that feel that affordable housing's gotten worse in our community. That also includes the 7% that say it stayed the same. So that's 98% think there's a problem with affordable housing in this community. That's just an incredible statistic. And one of the things about housing is every dollar we drive up housing costs is another dollar it takes to have a living wage in this community. So the concern about living wage should also be the concern about how are we as government driving up the cost of housing, because being in secure housing is just such a big thing for people as far as, you know, how much stress there is when your housing's insecure and how integral stress is to good health. And that's, you know, just such a big issue for people. So everything we can do to keep housing costs down should be done. So, you know, everything we think of that adds a dollar to the cost of a house, we should really seriously think about that. And we should be doing everything we can to get more housing supply into the market to bring down that cost. Because if we can bring the cost of housing down, that will lower what a living wage in this community is and bring people out of poverty without having to really do much other than try and make more housing available. So, you know, it's a big issue. I do appreciate Commissioner Burney's remarks about how we've driven some exclusion in our community through certifications and all that. I would just like folks to think about where some of that exclusions come from, because there's a lot of it has come through government. And I can remember there was a celebrated case about 10 or 15 years ago about somebody that was doing basically the braiding of hair and got slapped down by a county or state for not having a license in cosmetology. And all they were doing was braiding hair and charging a nominal fee. That sort of thing we have to always also be careful of, you know, as we think of new licensing requirements, adding to licensing requirements. And in particular, sometimes it's the people in the industry that start adding this. And I would think of the teachers unions that have started to make bachelor's degrees and master's degrees required, you know, for some of these teaching positions. You know, I couldn't walk in and start teaching high school math with my engineering degree because I don't have an education degree. So we have to think about where these exclusions coming from and how's that driving some of that disparity in our economy, and start breaking down those barriers. So two great things to work on. Everything we can do to get more housing and make it more affordable, and everything we can do to break down those barriers and those added certifications that keep coming up through various organizations. I'm right there with you, Commissioner Burney and Commissioner Farr.
Any other comments or questions? Commissioner Sorensen, sorry, I only see a portion of your face and not very much of your hand.
Thank you. Sorry about that. Can you hear me now?
Mm-hmm.
Yeah. I just wanted to ask a couple of questions about the role of the Board of Commissioners in this whole CHIP process. What is the role of the Board of Commissioners in the CHIP process?
I can start with that. The Board of Commissioners is one of the approving bodies of the Community Health Improvement Plan as the lead for Lane County, as one of the core partners.
Could you distinguish the CHIP as the term is used for the children as opposed to the community?
Yes, Commissioner, thank you. It is the Community Health Improvement Plan, not the Children's Health Insurance Plan. Thank you.
Okay, and who requires the CHIP that we're talking about today, not the other CHIP that's in the national news?
Thank you, Commissioner. The CHIP satisfies several requirements. Our public health department's accreditation requires a CHIP. And we also have that same requirement for CCOs in our state, as well as for community benefit purposes for our nonprofit hospitals. So that was sort of the motivation behind our initial coming together. And then we have had many, many other community organizations join us who acknowledge that this idea of collective impact is good for the community as well. So
it's not a state or federal requirement.
Commissioner, it is a state requirement for CCOs.
Okay, so any CCO is required to have a CHIP.
That is correct, Commissioner. And also it would be a federal requirement for nonprofit hospitals.
Okay. With regard to return on investment, I noticed that one of the big returns seems to be education, where the more formal education, the lower the public health problems. Is there any way that you've done anything in the way of return on investment? That is, housing seems to be, if you're homeless, you're going to have poorer health outcomes if you're not as well educated. But then government has to make choices of how it invests public funds. What is the better return on investment? More health care, higher education, or better education, or more formal education, or better housing, more than one bathroom per house? I don't know how you would measure such a thing, but is there any way to help us quantify, other than our own individual biases, is there any way to quantify what the best return on investment would be?
I will start with that one, Commissioner, and if Jennifer or Dr. Pat have something to add, they can also. I do not have that data in front of me. There obviously is a lot of difficulty in assessing return on investment for health investments. There definitely are data available, and I would be happy to provide some of those for our strategy session. So when we bring the CHIP, and after your approval of that, we will then engage with you again to determine the strategies that the board is most interested in supporting. And when we do that, we would be happy to provide the data that are available for the particular strategies to help inform your decision making.
Yeah, and last but not least, I'd just like to say that Commissioner Vozovich and others on the board have in common with me that barriers to teaching are really real. And in his case, he mentioned you can't teach math in a public school. Well, you know, somebody with a master's degree in geography or a law degree can't teach social studies in a Oregon public school. I've had other people tell me that experienced craft people cannot teach in an Oregon public school. Someone who's been a bricklayer cannot teach bricklaying, for example. And so that's one of the reasons why I think investment in community colleges is so valuable, because all of those barriers are I won't say eliminated, but they're mitigated in the case of community colleges. Thank you.
Commissioner Burney.
I know we ramble, but this is such a large topic. First, while I don't like mechanisms of exclusion, maybe it is good that the two commissioners aren't allowed to teach our. I'm just kidding. Forgive me. I would like to suggest that one of the greatest indicators of people becoming healthier, this relates to the first question I asked, is hope. And I know hope is intangible, but hope that if one puts forth effort, one can achieve everything listed here, from housing to childcare, etc. Oftentimes that's the other side of the equation, which is how do we motivate people to be responsible? And we see contradictions all over. Forgive me, but I have to point out, I had blood work done this morning, and I'm going to get in trouble for this, but everyone that was working at that healthcare establishment was not healthy. And when I go and I see even healthcare workers unhealthy in some way, I'm wondering, you know, it's just there's a disjunction, and all of us are role models for our children. All of us are role models for that, how they're going to compose themselves. What is proper behavior, you know, for the greatest personal good as well as social good. So as you're plodding forward on this, as we all are together, I think one of the links between these economic kinds of social determinants of health, I should say perhaps achieving them, are social, or, you know, inspiring behavior to be healthy. I just think hope is one of those things that connects the two, for what it's worth. Thank you very much.
Commissioner Farr.
Thank you, Chair Buck. And as I promised, I'm back with a couple of questions about housing. But first, the second to the last slide is a slide that you said is the chip, and I'm presuming that's the draft chip that will be actually endorsing subsequent to this. That slide right there, yeah.
Yeah, this is the framework of the chip. The actions are still being developed.
Right on. And one further question on that, Dr. Warren, you stated that the Board of Commissioners is one of the approving bodies. What are the other approving bodies?
Sure. Thank you, Commissioner Farr. The other organizations that will also approve the chip are the Lane County Health Council, which is the Pacific Sources CCO's Health Council, as well as the Trillium Board and the Board of United Way. Excellent. Oh, and I'm sorry, I forgot Peace Health Hospital. They also approve it. Thank you.
Peace Health Hospital.
Yes.
Okay. So, okay. All right. That's an interesting group. All with a pretty direct impact and interest in health. But I see the Board of County Commissioners as being the one that has the greatest interest in housing, the greatest ability to address housing needs, and the greatest ability to include tactics inside of the framework of the chip, inside of the strategies that really significantly address housing. 98%, 91 plus 7% of the people we have surveyed feel that we're not doing a good job improving the housing needs in the community. So, I'm almost at a loss for words how to emphasize that. I cannot overemphasize that housing affects everything. It affects education. I had an intern in my office for almost 2 years who didn't have a home. He was a student at Calapooya High School, graduated from Calapooya, didn't have a home, but he wasn't classified as homeless because he was couch surfing. He always had some place to stay, and he always had food, but he didn't really know where he was going to be next month. How does that affect your education? You know, every single thing that we do, childcare is affected by housing. And so certainly economic strength helps people to stay in housing. But as Commissioner Bozievich just said, and I believe we all agree, although I don't want to put words in people's mouths, finding ways to save every dollar we possibly can on providing housing, adequate housing, has to be a main focus that we have. If we don't do that, then we're failing to address a lot of all of the other areas, Dr. Warren. And you know, I thank you for this wonderful presentation, the work that our public health portion of Lane County's Health and Human Services Division works. We didn't hear very much, if any, well, we heard nothing about behavioral health. We heard nothing about human services. We heard about physical health today. I actually serve on the physical health advisory, public health advisory committee, as well as the mental health advisory committee, as well as the community health council and the Human Services Commission. So I get to hear from your professionals very often about the state of the health department. Also, and the PHAC and MHAC from the community, how they feel about our work. So I have a lot to say. I'm not going to say it all here, but so the most important thing that I will state once again is that if we aren't doing something about housing, we're failing on all the other fronts, because housing really affects every single thing, every other thing that we can possibly address as a board of county commissioners. And of the bodies that you mentioned, the 5 bodies, one of them is charged more than the others with housing issues and has the greatest capability, and that's the Board of County Commissioners. We have to take that on, and we have to make certain that it is a strong part of our community health improvement plan. Dr. Warren, thank you. To staff, Ms. Gaffney, thank you. And Jennifer, thank you for the presentations today. You guys are truly, absolutely wonderful.
Thank you. Thank you. I appreciate the report as well. And I look forward to seeing the actionable items that come of this. You know, often times we're talking about external forces that seem so much bigger than us, and they have such a huge magnifying effect on the day-to-day level of everybody's lives, which you've clearly put together in this portion of our report. And it almost feels overwhelming. Overwhelming to staff and the public in general is, how are we going to tackle this problem? I mean, it's just so big. And knowing that we have a role in that, and not only with the report itself, that is the guiding light of where we want, you know, our community to go, but also all the little pieces within that transform it over time. When we are a piece of every single one of those external forces. As a governmental agency, it's our responsibility, of course, to continue all the good equity work that we've started. Without that piece, it will seem hollow going forward. And I think we're going in the right direction. I think all your work is just incredibly important to our community. But I don't want the community to feel like it's so big that we can't tackle it, because we can. And if anything else, it's local government that will do that more than you know, bigger, greater state or federal government. We have such a key role in this, and we can move it forward and make a better life for our community. Thank you so very much for the report.
Thank you, Chair Buck and Commissioners.
Chair Buck, may I just, I said I'm on the PHAC, MHAC, and CHC. I am not a voting member of any of the 3 of those. Those are all community members that are the voting members. I'm simply the liaison. Human Services Commission, along with the Commissioner Bernie, I am a voting member of.
Very good.
And if I may, Chair, I just want to thank you all as well. sometimes my questions or comments sound critical, but it's only because of the attachment to the issues that you're contending with. So thank you very much.
All right, well, with that, we will adjourn our Board of Health, and we will begin our regular Board of County Commissioners meeting for November 3rd. And the first thing on our agenda is if there are any adjustments to the agenda. All right, seeing none, is there any emergency business? Seeing none. The next item, which is always one of my favorites, is employee recognition. And I'll hand this over to our administrator, Steve Mokryski.
Thank you, Chair. This is also one of my favorite opportunities in the board meeting to recognize some of our great employees. And we have with us this morning Lucy Zamorelli and Leilani Brewer from Lane County's Health and Human Services Department in the Lane Care Division. I'm going to, how about this? How about if I turn, because I want to make sure they get the airtime here. I'm going to turn my camera off. You see Karen there. Karen, you want to turn your camera off, and then maybe we'll, I'm not sure who, well, there's Lucy, and I think Leilani is with us as well. And I want to just start with a story here. I met Leilani several years ago. Community member Juan Carlos Valle came to my office and brought Leilani, who is a local resident and had finished her some advanced degree work. And we were at the time thinking about creating an equity internship program. And the idea with the equity internship program was that we would create this pipeline of talent into the organization, and that we would allow for opportunities. We would open our doors to people who have historically not had the same opportunities as folks who look, say, like me, really to promote diversity and equity in our organization and create opportunities for diversity in our workforce. So in that meeting, I encouraged Leilani to apply for an equity internship, a paid opportunity to have an internship opportunity in Lane County. And then the goal was to build that individuals that go through that program can build relationships and have an opportunity at full-time employment. Well, because Lucy Zamorelli has long been committed to our equity work, she embraced. It really required our supervisors to say, hey, I want to take on an intern in our area. And Lucy did that and brought Leilani on as an intern in Lane Care. Long story short, because Leilani is an outstanding professional, she earned an opportunity for a full-time job in Lane Care, and Lucy hired her there. And so here, I just wanted to share that, a little bit of that background. We have a sort of a confluence of great things that came together because we have great people in our community that deserve opportunities to demonstrate their skill and talent. And we have great people within our organization who want to create opportunities for people. And now we have this opportunity to highlight those two individuals in particular. So Leilani was one of our first equity interns in Lane County, and then was hired in Lane Care. Lucy Zamorelli has been a supervisor in Lane Care for going on a decade now. And they both are just outstanding individuals in our organization. I'll say that Leilani has also served as a United Way loaned executive. So we loaned her to United Way as a loaned executive, and together they've just been an incredible team doing great work. And so we want to recognize them today really as amazing examples of our core behaviors in Lane County: a passion to serve, a drive to connect, and a focus on solutions. They have stepped up to offer support both for our emergency response to COVID-19 this year, as well as the wildfires. These are employees who've gone routinely above and beyond. They seek out opportunities, not just to do their job, but to say, how can we help? How can we help the organization more broadly? How can we help our community in ways that are needed? And so when the pandemic struck, they were ready. And they were ready to just seize the opportunity to give back to the organization and the community. And so there was this call to develop a resiliency plan. And you see Diana Jones brought up here this community resiliency toolkit. I'm going to just maybe in a moment walk through a couple pieces of that. But this is the result of Lucy and Leilani's work. I think, as the board certainly knows, through the pandemic, such a challenge, not only physical health, that we're in public health that we're challenged, but the mental health component of this pandemic, for all the reasons that we know, has been such a challenge. And so there's this effort to create this resiliency plan for the community, to really a one-stop shop to say, for the various parts of our community, how do we build resilience? And when we talk about resilience as it relates to this project, we're talking about toughness, flexibility, and being able to recover quickly from hard times. So both Lucy and Leilani, no strangers to working with the community in areas like our coordinated care organizations, within the system of care for youth and families, with the Lane County Pain Guidance and Safety Alliance, in maintaining and monitoring behavioral health and clinical advisory committee and its numerous subcommittees. Because of who they are and their ability to garner community support, not only their work within the organization, but their work in the community, within a very short period of time, the Community Resiliency Work Group was developed. This work group created 10 task teams to cover the myriad of special populations needing specific interventions in order to create the focus needed to design a toolkit that meets all the needs of the community. You'll see this when we walk through it briefly. It's just very, there's so many complex needs of the community, and we wanted to create this one-stop shop so that people could come and say, depending on what their need was, that they could access the resources necessary to be resilient. What's truly magical and a hallmark of Lane County is how many participants gave their time, energy, and expertise to this endeavor. It was truly a community effort. So this will continue to serve our county and our community, and the extra steps have been created to create to make this an accessible tool for everybody. And I want to just walk through the final toolkit is a living document, so it's updated regularly. And maybe what I should do is just touch on this very briefly, and Lucy and Leilani can maybe go into it in a little bit greater depth, but I'll walk through the basic areas. It's a living document, updated regularly, to be accessed on Lane County's website that you see in front of you. It includes resources, trainings, information, and tools to help with stress and basic living needs. The 10 specific toolkits are children, youth, and families, older adults, and people with disabilities. You see these in sort of, you can if you have an iPad or a touch screen, you can expand. On the left-hand side, you see the cursor there where Diana is highlighting. These are the 10 areas: children, youth, and families, older adults and people with disabilities, chronic behavioral health conditions, unhoused individuals, unaccompanied youth in poverty, ethnic and racial diversity, gender non-conforming populations, veterans and military families, healthcare workforce and system transformation, community, faith-based, and fire recovery resource. So this started as a COVID-19 response to the pandemic. And then of course we had the wildfires hit. We go, oh my goodness, these people who needs this more than anyone right now are the folks who are dealing with not only a global pandemic, but being displaced from their homes and everything that comes with that. And so, they've done, Lucy and Leilani done incredible work, and that's continuing with the wildfire response and recovery. So great work. I just want to say, these are really two incredible people I've had the pleasure of working with over the years. And I'm so excited, both because of the kind of story that they represent, the commitment to our equity work. And when we're doing things right, we're bringing people, our people are embracing the opportunity to bring new people into the organization and giving them opportunities to shine. And we see that happening here. And then that they're seizing the moment, that they're focused on solutions, they're passionate about their work, they're connected with others. Those are our core behaviors in the organization. And so you really see those exhibited by Lucy and Leilani. And so I just want to I could go on and on, but they're incredible people. I'm so proud of the fact that we have people like them in this organization, and they stay here and they are committed to doing this important work. And then I mean, you know, this is an example of leadership at all levels of the organization. Leadership isn't about where you sit on an organizational chart. It's about your ability to compel others towards common goals. And so anybody, we say this regularly, and here are examples, anyone in our organization can be and should be a leader when they're doing their job to their fullest. Lucy and Leilani are great examples of that. So I'm gonna stop there. I wanna turn it over to Karen Gaffney to add some comments, and then we'd like to allow Lucy and Leilani to share some words. And I would say you all will be much better at walking through the toolkit, this toolkit. So I think the board would love and the public would love to see that as well. So Karen, you wanna take it from here?
Thanks, Steve. And I will keep my comments short because Steve, you did a fantastic job of really casting why it is that that these two particular employees and this project are here today. I've had the blessing to be able to work with both Leilani and Lucy on a variety of projects over the years, and this one in particular was huge for us as a community and us as an organization. You know, oftentimes we talk about in times of a crisis, which certainly COVID was, you know, there are going to be some opportunities, and we don't want to miss what the opportunity is in the really hard crisis. And so we turned to the team here to say, help us figure out how to support people's mental health and wellness was where we started during this really hard time. And through that, they created this toolkit that clearly goes well beyond just COVID as a response and lives past our fire response, and really is a resource for our community in an ongoing way to help people whenever there is stress and hard times. So I'm excited about both the product that they developed and the process. I know there was an opportunity to acknowledge the many people in the community who also helped contribute to this effort. So just to circle back to Steve's piece around leadership, both Lucy and Leilani have fantastic talent in bringing people together and really leveraging the very best out of those group processes too. So I think I will stop there, and I don't know if Lucy or Leilani, it'd be great for you to walk us through a little bit briefly the toolkit, and then if either or both of you have any comments you want to add before we turn it back to Chair Buck.
Oh, well, I would just say thank you, Karen and Steve, for all the kind words, and just really have to pass the honors on to the community that helped to create this, because we had just, you know, probably over 100 people contributing. And it was an amazing process to see what everyone wanted to include in this toolkit and how often everyone met, and just the level of response from, you know, the Eugene Police, DHS, the Department of Human Services at the state, all kinds of nonprofit organizations, many folks from the county stepping up, you know, taking this on in addition to their real jobs. But I really have to give, you know, so much of the credit for the success of this toolkit to Leilani, who, unbeknownst to me, has a lot of web design talents that we hadn't recognized previously to starting this project. And Leilani has put together an amazing resource. So Leilani, why don't you take it away? You're on mute. It becomes one of the most common things we say to each other. You're on mute in these meetings. There's like a little button up in the right. Nope, still on mute.
That's the second most common, still on mute.
Yes. And of course we did put this whole toolkit together virtually, which actually gave us the opportunity to see how amazing virtual work could be, because part of the reason we had such great involvement, I think, is because people didn't have to go someplace. They could just do it from their home office or wherever they were located. So I'll go ahead and say, Diana, why don't you just go ahead and open the fire recovery resources, and we'll just take a look at that. As you go into the toolkit, you'll see that there's just more and more things embedded in them in each area. So if you go, it's very easy to find all of these. So then as you go into each of these, let's just click on the, let's see, maybe why don't we click on that Trinket and Sam and the big fire, the fire recovery resources. We just had a lot of resources for families and kids, and I might have picked something that's going to be too big to open, but these are wonderful coloring books that we have printed out, and we are taking them up to the fire areas. And okay, so we can kind of see a little bit of this over on, yeah, there it is coming over. So this is done by the National Child Traumatic Stress Network, which is an organization that's national that treats stress and trauma in children and families. And so these books, they have one for hurricanes, they have one for natural disasters and floods, and this is the one on the big fire. And basically it takes you through the whole process of a fire. And what's really neat is that this is as helpful for adults as it is for children. So you get to see that it's really okay to have the sudden disruption of a fire in your life, and that it's scary, it's frightening, and people will lose their homes, and then, you know, what are you going to do about it? So Leilani took the initiative to get little packets of crayons together, and we've given out just hundreds of these books. What's interesting is many older adults like them to give to their grandchildren too, to help them understand why grandma and grandpa's house doesn't exist anymore. So we do have a large older adult population up in the Mackenzie Valley, and it's been really helpful. And so, you know, it's kind of, so anyway, we can go back to something else. Let's look at something else. This is just the kind of thing, it's printable, that you can get out of the toolkit. Let's go to one of the toolkits. Go back one more, Diana. Let's go to one that's maybe, well, I should ask you, what do you want to see? Veterans, older adults?
Unhoused.
Unhoused, okay. I should have guessed on that one, Commissioner Farr. Okay, let's click on the unhoused. This one we did a lot of work on with our county partners and also our state partners, and ended up folding in our unaccompanied youth group as well, because we were doing a lot of services for youth. Okay, so this will just take a second, I think, to load, and then we can take a look at some of these resources here. Leilani, did you get sound yet?
I think so. Good morning, everyone. Can you hear me? Okay, I called in. I don't know what's going on with my button earlier. It showed it was green, but anyway, thank you so much, Steve, for that great introduction. I remember that day that we met, and it really lit a fire to want to work in public service. And I'm so happy for the opportunity I have with Lane Care to do just that. So much community engagement in this project. You'll see each of the toolkits have a thank you to our community at the bottom. And it's just a lot of fun connecting with the community and hearing from them exactly what their needs are. So I hope that this continues to be utilized. I know we get Google Analytics reports each month. In September, we had over 700 unique visits to this page. And then October, it was around over 400 visits. So being used, but definitely could use a push in the community to get this toolkit out. But yeah, let's continue and look at this unhoused toolkit.
So you can see we have a coordinated, yeah, go ahead, Leilani, take us through. You do this so well.
Oh, okay. So yeah, you'll see that just recently it was updated with some information on the Egan Warming Center and what we're currently seeing in our community, a call to action of folks to get into contact if they have any shelter options. But you'll see that each of the community toolkits is formatted around the same way. There are the links that extend over into other information. We did work with Human Services to come up with some language, especially for the coordinated entry, supported housing. Community can get a little bit confused on what that stuff means. So as you click into those different tabs, you'll see that there is some more information on what the meaning of coordinated entry is, supported housing, affordable housing, and then we have some more information under service navigation around how there are some maps that you can download on how you can navigate the, right there, healthcare and social service navigation resources. There are some maps that will show the Lane County alcohol and drug referral pathway, youth mental health, and adult mental health that will take you through Lane County and the various options available. So those are really great maps that I like to showcase in various of the toolkits. So yeah, take time, please, to go through the toolkit. You can get to it really easily by just adding a /toolkit to the lanecounty.org website, or you can also do a Google search for Lane County Community Resilience Toolkit, and it will be the first thing that pops up.
So much information embedded, and then there's videos. There's also the toolkit translates into 10 languages. So it's very helpful for people who don't speak English well, just to learn about our system, just to be able to go in and see what's available and what the vocabulary is. You know, what does it mean when you hear coordinated entry? That's not something that would be intuitive to understanding if you don't speak English well. So we're happy about that. And we've got all of our Lane County offices front and center on top of our links over on the right-hand side. So yeah, you know, it's been really great. And Diana, go all the way down to the bottom on this one, and we'll see all the different community partners who helped us to put this together. If you just scroll down on this page to the, let's see, I think we're back. Let's go to one of the toolkits and then look. Go ahead and open like children, youth, and families, the one on the top.
Okay, here we go. You can scroll down to the bottom. Yeah.
Yeah, just scroll down on this page. So this is our list of people. If you go up just a little bit, you'll see how this is just how many people worked on just this one toolkit. We did a thank you to everyone. So just this one toolkit had all of these community partners meeting every other week throughout the summer to create this one toolkit. And so each of the toolkits has a list like this. So you can see how much collaboration, what an amazing, wonderful community we have in our behavioral health field, people coming together to help with this. So I think we'll leave a little time for questions.
Well, thank you so very much. Are there any comments or questions from commissioners? Commissioner Farr.
Only a comment, and Lucy Leilani, this is remarkable because for years I've been asked questions that I don't know the answers to. And if you look at the toolkit that I'm looking at right now, which is unhoused and youth, unhoused individuals and unaccompanied youth in poverty. You go to that toolkit, any one person, whether you're with the media, whether you're a county commissioner, or you're just curious, you can find almost every answer regarding what we're doing locally for homelessness and youth. And you don't have to dig very far for it. It's unbelievable. It's remarkable. It's something I've been dreaming of for a lot of years, and you're bringing it right to us. So Leilani, great work. Lucy, thank you very much.
Thank you. You know, Diana, will you open the racial and ethnic and racial diversity? You know, it's this one that we struggle with so much in our community, because we in some ways we're a very white community, and in some ways we're not a very white community, and we recognize our disparities. this was probably one of the ones that we enjoyed working on the most, I think, Leilani and I, because we are very diversity focused. And what we discovered is that the need for this kind of work to continue was so great that we actually started a new work group that is called our Equity and Inclusion Work Group that we're going to keep going. And it came out of the work that we did on this toolkit. Diane, if you scroll down to the bottom, you'll see all the folks who helped us to put this one together. We had some really amazing help from the Department of Human Services, from Elton Villanueva, and Mark Harris was just fabulous from NAACP. Ibrahim helped out from NAACP as well. So this was just Mo Young, of course, our amazing Lane County Equity and Access Coordinator, who we just love working with. You know, this is something that is starting us on a new way of collaborating with our community partners just on race and diversity in the behavioral health system. And we are lucky to have had some funding from the state for BIPOC projects that has gone out recently. And, you know, we want to keep building on this so that we can be a community that offers to people who feel like they can't find anyone who has their lived experience in the behavioral health field. We want them to know that there are services for them and that there's access to those services. And so often those populations end up in criminal justice or corrections because there's no appropriate services. So this is one we're very excited about. And it's a really good toolkit too. Lots of great information in here.
Commissioner Burney.
I don't know if I can remember my question. First of all, thank you for doing this on behalf of everyone who's benefiting. You know, when people come into different apprentice programs, they're given toolkits or tool belts, and much of the curriculum is teaching them how to use the tools. So my question is, one, are you tracking substantively the results of people using this, or are we even able to? And two, do you think it would be helpful if somehow one was able to get hundreds upon hundreds of community members that live in communities, know their neighbors, and have them trained in how to navigate this toolkit on behalf of their friends and neighbors?
I love the idea. I think it's fantastic. And I think it's exactly what we need in our community resilience work. Leilani and I both are really happy to come and talk to anybody about the toolkit, to walk through it. We've done that probably, maybe 24 times since the toolkit went live on September 1st. So I think any ideas you have on where we should go, we would welcome. And I think it's a very good idea.
Thank you, because what I'm referring to would be even more substantive than that.
Like collecting the data?
Like collecting the data, training people on its use, and having them just out among us.
I think we should do it. I think our data has pretty much just been the hits, but.
Any other comments by commissioners? Commissioner Posevich.
Thank you. And Lucy, it's great to put a face to the voice I've been hearing in SIT-STAT and cooperator meetings for the last month or so. Keep hearing, and Lucy, never quite put the face together. So I really appreciate the work you've done in our EOCs over the last couple months. It's been really great work, and I really appreciate this tool. I won't say much other than I sent both you and Leilani a quick email because I noticed there were a couple organizations missing in the rural area. So I sent you quick links to their websites and all that stuff. As I looked at you have a spreadsheet of community resources there, and I noticed a couple missing. So I would encourage the other commissioners to click that link and look at those organizations and see if there's somebody you might think that should be added to that list of resources. That's an incredible, that spreadsheet in itself, what an incredible resource where everything from, adult and youth crisis response to, where you can get food, other help. That's what a great list. And I just want to try and make it even better. So I sent you a couple more names. So thank you for the work
Wonderful.
you're doing. Yeah, thank you for the work you're doing. And, resilience is something very near and dear to me. I spent one of my years as a board chair dedicating my year to resilience work. And I really appreciate all the work you guys are doing in that. So thank you, both of you.
Thank you.
Thank you, Commissioner Buck. And you just, that is a great example of how this toolkit is updated, and it's a living document. There has been collaborations with Veteran Services that connect with me regularly, Goodwill, to add information, update it, and especially that spreadsheet. That's what makes it work, is that community members will reach out to me and let me know that some updates need to be made or additions. So thank you.
Any other comments from commissioners? I'll just say it's been my pleasure to work with you, Lucy, more and more as we go through fire response and recovery. I see you at several of our meetings, and I just thank you for your work. And Leilani, thank you so much for what you're doing as well. Clearly, you both are such huge assets to Lane County. We appreciate you choosing Lane County to work for. The community is definitely greater for it. So a big kudos and round of applause for our employees. All right. We're going to move on in our agenda today. Thank you both for coming. So we're going to move on to public comments. And I'm going to hand this over to our moderator. This is a good time if people have or have something to say and want to make a public comment to raise their virtual hand.
Thank you, Chair Buck. And I do show that we have 2 people who have registered for public comment. I do not see any hands raised. So if you have been waiting to give public comment, please raise your hand and I will call on you and begin your public comment. I'm still not seeing any hands raised. So I'm assuming we've just got people who are listening to the meeting and who did not plan on public comment. So I will turn the meeting back over to you, Chair Buck.
Okay, we'll move on to Commissioner's remonstrance, since there's nobody to respond to. Any remonstrance? Commissioner Sorensen.
Thank you. I just wanted to briefly comment on the importance of today's national, state, and local elections. The right to vote is not a right that is guaranteed in the U.S. Constitution by the original text of the Constitution, and many people have advocated for an original interpretation of the Constitution. And of course, that would mean that women or people that weren't white or renters would not be able to be considered part of the group of people that were involved in the original text writing of our Constitution. That view of the Constitution has recently been approved by the U.S. Senate in confirming Justice Barrett to the Supreme Court. I'm very disappointed about that. Of course, I was very disappointed when the Senate did not remove President Trump, but I have high hopes that today's election will be a national referendum on those decisions, and that the current view that I hold, that the Constitution is a living document and it is interpreted by many different techniques, and it is not simply a automatic matter of looking into the minds of 17th century white landowning men to determine what its meaning is. And so I'm really pleased the way Oregon's election system works, how we have so many proper things in place to make sure the election is run fairly, that is run efficiently, and it is run without political bias of whatever county or state election officials involved. And I also want to thank Sheriff Harold and other law enforcement who have been responsive to concerns about voter intimidation, and Ms. Perlow, our district attorney. And anyway, I voted. I hope you vote if you're allowed to vote. And I hope you vote intelligently and with an eye toward the proper election and bringing into office good people that have the nation and community and state at heart. Thank you.
Any other remonstrance, Commissioner Bosevich?
Thank you. First, I want to thank the chair and the board for allowing me to be absent last week. I traveled to Kentucky with Elizabeth to see her dad. And, you know, it was really touching to see somebody that survived attempting to cross the Rapido River at Casino, the breakout of Anzio, D-Day, Southern France, and all of that, break down in tears when he saw his daughter walk through the door in his nursing home. You know, it was a great trip, and I really appreciate the opportunity to do that. Unfortunately, one of the things about being on that trip was it was very difficult at times. His nursing home is out in the sticks in Kentucky, and I don't have a whole lot of cell service, and was not able to participate in the meeting when the issue about adding the 4 FTE that we are going to be finalizing here under our consent agenda comes up, and getting to talk about that a little bit. But I just wanted to say I really appreciate the board's unanimous support of that last week. I'll be supporting the consent agenda today for the same reasons. I'm really proud of the work that I and past boards did to set up our ability to finance that. In particular, I personally fought to account for federally generated road funds from timber replacement dollars separate from other road fund reserves. And it took quite a while to get that to happen and to start happening, but it's the only reason we're able to pull that money from the road fund, because other road fund reserves are not eligible to be spent on patrol services, only the federal money. And I just, you know, this is kind of the fruition of my fight to do that accounting separately. The other part of that is past boards made a decision with our administrator to treat SRS funds that came in above harvest levels as one-time funds and to put them into reserves, because we understood that it was a year-to-year battle after the end of the SRS taper down, whether or not we got any funding at all. In fact, there was one year we got no SRS funding and we were just at harvest levels. And it's that money we set aside in the general fund that was utilized to fund 2 of the FTEs. So that separation and setting aside of some of that federal money that comes as forest harvest replacement dollars is how we're managing to fund these 4 FTE. The unfortunate thing is one of the organizations, and particularly when it comes to that general fund forest dollars, those are only coming into our general fund because of the O&C lands. And we need to continue to be participating in discussions around re-up of SRS and any harvest plans for those ONC, but we're not now a member of the one organization that specializes in advocating for those lands. So I really appreciate, adding these 4 FTE for the next 5 years. It's making a huge difference in my district. We participated in a grant to start a pilot to basically have a Kahoot-style mobile mental health crisis response in Western Lane County. But we have not been able to go past phase 1 inside the Florence city limits because we could not get law enforcement backup for that responder. And what people don't understand is Cahoots doesn't work without having law enforcement backup in case things go beyond their capability. And finally, now with the resident deputies being assigned out in West Lane, that mobile mental health response is going to be able to start going beyond the city limits of Florence into places like Dune City and Deadwood, because we'll have a deputy out there. And I just really want to thank the board, thank the administrator for putting this proposal together, and the sheriff. It's really going to make a big difference and do almost exactly what we're being asked to do by a lot of those folks that have been out there protesting about how our public safety system works. We're expanding a mental health response instead of a law enforcement response, but we have to have the law enforcement there to back them up. It goes hand in hand, but we couldn't do it until we added these FTE. And I really want to thank the board and appreciate everyone involved in doing this. Thank you.
Any other remonstrance? Commissioner Farr.
Thank you, Chair Buck. I have 3 things that'll go very quickly. The first is yesterday afternoon, I spent a portion of my afternoon with an old friend, Colt Gill. He was making a presentation on local public health role in the reopening of schools, including the matrix that is involved in reopening the schools. I won't go into any detail on that because local public health has a role in that, and our department knows all about that. But I wanted to mention Colt Gill. Colt Gill, my first elective office was as a school board member at Bethel School District, and Colt Gill was one of a long string of excellent superintendents of Bethel schools. Colt is now the director of the Oregon Department of Education. Anybody who's in contact with him knows how well he performs his job, how good he is, and how innovative he is. So Colt Gill is once again a one in a long line of superb superintendents from Bethel School Districts, which is the line is carried on right now with Chris Para. The second is that the Performance Audit Committee met last week and continue to contemplate what is the future of the Office of the Performance Auditor. That's something, I'm not going to talk about it much right now, but it's something that's going to be coming before the board, and it's a hard decision that we have to make. How are we going to move forward with the Office of the Performance Auditor? Third thing, very quickly, I got mine. If you haven't got yours yet, get your flu shot. I got mine over at the Surgery Center, and they actually let me in out of turn because there was a lull in their giving flu shots. But doesn't hurt, it feels good, and it really feels good to not have the flu. So thanks to Lane County Public Health for those free flu shots that they're giving to employees.
Commissioner Burney.
Well, I want everyone to know I got mine. You haven't got yours either. I'm kidding, Commissioner Farr. I just a couple of comments. One is Commissioner Bozovich, I wish you were here last week because that was thoroughly discussed. And there's a reason why we unanimously supported it. I think that there are structural things that are historical that relate to where we are, and there are many of them. And then there's our ability to make decisions now on the basis of that. So I was pleased to be one of those that voted for that. Commissioner Farr, I have to share with you that the 2 people you mentioned, Ms. Colt Gill and Chris Para, Bethel has a way of sucking up talent from the South Lane School District.
Including Kent Hunsaker, right?
Yes. And so I think we should give Commissioner Buck's district the kudos in becoming the pool of people from which Commissioner Farr's district has benefited. And then, of course, they've moved on to become leaders in education in the state of Oregon. That's all I have at this point. Thank you, Chair.
Thank you. I'll just remind everybody, you still have until 8 o'clock to vote, and we count every single vote. So feel free to drop that ballot in, even if you're a procrastinator and it's the last moment. We still want it to count. All right, we'll move on in our agenda to county administration. Item number 1 is our COVID-19 response and recovery. And I'll turn this over to Mr. Mokrajski and Ms. Karen Gatlin.
And I'm going to give it right to Karen. I know we're going to try to make up a little bit of time here, and she's got a great update for you. Go ahead, Karen.
Thanks. I'm doing camera and screen sharing and audio and trying to get all of my devices lined up. So, good morning again, Chair Buck and commissioners. I will move fairly quickly through our slides this morning, just knowing that you had an opportunity to hear from Dr. Ludke this morning about COVID vaccinations, and I will leave time certainly to answer any questions that you might have since I was here last week. So I'll start just quickly for both you and for the general public, giving an update on our overall numbers. As of this morning, we've had 2,634 people positive for COVID-19 in our community since the beginning of the pandemic. Of those people, we have 142 who are currently infectious in the community. 18 of those people are hospitalized as of this morning, and we have had 28 people die as a result of COVID in our community. As of yesterday, we had 16 people who were at our River Avenue Alternative Care Site facility, and we expect that there may be some additional people who move into that facility today. Again, just as a reminder for the public, that's a facility that the county purchased to assist people who need to have isolation or quarantine and aren't able to do that at home. It's been a great project in cooperation with Occupy Medical, who manages that facility for us. And as of yesterday, we had 587 people who were under monitoring in the community because they are in quarantine and close contacts of people who are positive for COVID-19. I will say, while all of those numbers are much larger than what we would like, we overall are seeing slight decreases in new cases, and I'll show you that when we get to the epi chart in just a moment. So I almost hesitate to say that out loud. It is way too soon to call it a trend because what we know about this disease is that the numbers do bounce around. However, I think it's important to acknowledge, in the same way we do when the numbers go up, acknowledge when they start to decline. And because that has a very positive impact on our numbers of people who are under monitoring, those who need case management supports in the community. And I want to give kudos and encouragement to the community to please continue to do those simple strategies we know that will make such a huge difference of hand washing, mask wearing, social distancing that really makes such a tremendous difference and avoid those gatherings. I would also say we're also starting to see a slight downtick in our positivity rate, and we'll get to that chart in a moment as well, which is a positive thing for us. So here's our plan. And for those in the community, I'm not going to spend much time on this slide. It is available on our website if you have interest in that, and we'll do a couple quick highlights here. So I mentioned this is the epi curve that we look at each week, and this is the tool that public health uses to track the trends in the community in terms of the disease, and certainly helps influence our hospitals and other community partners in terms of planning. So we are seeing a little bit of a downward tick from where we were, and as a reminder, that gray bar reflects where we still expect cases to be reported, because this does track cases by date of symptom onset, not by the date that the lab happened to report it to us. This chart reflects our testing volumes in the community. You'll remember our goal was to exceed 500 tests per day, and we regularly are doing that. And I would say are closer to 1,500 tests a day on average each week. And I think in that way, we're able to track the level of disease in the community. These public health indicators are ones that the state tracks each week. And so we here have as part of our dashboard as well. You'll recall that for the last number of weeks, we've had a lot of red X's in our Lane County line. And this latest update shows that a few of those have turned green. We can see we've had a downward trend in our positive test results and a decrease in the percent of new cases. So those are both very positive in our community. We still do have an issue with sporadic test case results, and we'll show you that slide when we get to the later in the presentation. And in this report, we were able to reach 89% of people within 24 hours as part of our case investigation follow-up, and our benchmark there is to get back to 95%. As you know, we have been on the governor's watch list because of that sporadic case rate for a number of weeks, and we remain on that list now. This is the latest data that goes through October 24th, and you may recall for this particular metric, it's a 3-week look back. And so that's the data that's reflected here, and I've shown you both the statewide numbers for the last 3 periods as well as Lane counties. You can see our sporadic cases per 100,000 are currently at 68.1, and that number becomes important because that's the metric for being on the watch list. And it also, the reason it's the metric for the watch list is it's an indicator for us of how widespread and dispersed is disease in the community, that our numbers are not reflective, for instance, of just one large outbreak at a long-term care facility, but really we have a number of cases that are not connected. And this is the data that leads us to really implore the community to please answer the call when public health calls, because that's our mechanism to be able to link cases together. One big thing that has happened since we last met, and Commissioner Farr referenced this, I'm not going to take a lot of time to walk through the revised school metrics, but I do think it's important to acknowledge that the governor and the Department of Education have released revised school metrics, and I'm happy to answer questions. We have information on our website if people would like additional information, and of course the Oregon Department of Education posts data as well. You can see from this general overview that the state continues to look at new case rates and case counts and test positivity rate. What has shifted is there's no longer a statewide positivity metric that is being tracked. It really is based on local communities. And they have adjusted some of the numbers to allow for additional on-site in-person education, really acknowledging, as I've said here before, one of our primary drivers in our COVID work, besides protecting the hospitals, is being able to reduce cases enough so that schools can open. Under the new model, communities would need to have less than a 5% positivity rate to be green. However, if your positivity rate is between 5 and 8%, you can enter prioritized on-site or hybrid. So that's, we used to talk about K3. So it's now K3 and actually the rest of elementary school that gets prioritized in that yellow zone. You might recall our case rate. Well, I'll go to the next slide. So this gives you a sense of being able to have schools move between green, yellow, orange, and then if you're in the red, then that's mandatory distanced learning in a community. So let me show you our data. So this is the current data statewide average as well as Lane County. One of the other things that changed in the new metrics is instead of looking week by week for 3 consecutive weeks, we're now looking at a 2-week look back period. So that's what's reflected on here. The bottom line on the chart is the most current. So the time period is October 18th through October 31st. And you can see that our cases per 100,000 are at 133, and our test positivity rate is at 6.7. So if I go back up here, you'll see 133 as the case rate per 100,000 puts us in the orange zone during the current period, which would mean that there's not an opportunity for new schools to move to in-person education. We need to get that number down below 100. Our positivity rate is in the yellow zone, however, between 5 and 8%. So as the case rate drops per 100,000, then opportunities will open up for local schools to be able to decide whether they want to return to some in-person education for these prioritized populations.
Chair Buck, I will have a question about that specifically at the end of the presentation.
Well, and I think, Chair Buck, that's a good place for me to end my presentation, given our time today, and I'm happy to answer whatever questions I can.
Commissioner Farr.
I just have one, Chair Buck, and thank you, Karen. Ms. Gaffney, you've given us a great presentation all day long today. It's remarkable how much information we get. During the presentation yesterday by Director Gill, he talked about the Clackamas County provision, which allowed for certain schools in certain areas of a larger county to open based upon the metrics being generated by another geographic portion of the county. Is that something, of course, we're in the orange right now, so it doesn't really have much of an effect on us, but have we looked at that very much? For instance, if Oak Ridge has 0 cases and Florence has an outbreak in a particular industry, Oak Ridge is exempt from that. Have you looked at that yet, or is it too early to really pay any consideration to what he called the Clackamas County provision?
Chair Buck and Commissioner Farr, I appreciate that. I think I failed to mention that I have been out on vacation, so I have not, I'm not sure what was referenced as the Clackamas County exception, but I certainly will look at that. I can tell you right now, I know there certainly are provisions where school districts span different county lines. And if there are places where case rates are radically different in different parts of the community, I think that is certainly worth us looking at. At this point, our disease has been fairly dispersed across the community, but I will absolutely talk to our staff who was able to watch the presentation and get clear on that and get you more information.
Thanks, Karen. I thought it was a bit early. It was specific to an outbreak in a cannery in one of the Clackamas County cities. You know, Clackamas County has a lot of medium-sized cities as opposed to us that have 2 big cities and a lot of small cities. A lot of folks are wondering when schools are going to reopen, and the role of local public health departments is integral, and understanding how your professionals provide the state with information. That is how the state makes determinations as to where schools can open. So thanks again, Karen, for your staff and the professional work that they do, making certain that we're able to do things as quickly as we possibly can.
Thank you, Commissioner Farr. And I might make a shameless plug right here off of those comments to say, truly, the ability for schools to open relies on what everyone who lives in Lane County chooses to do in terms of their behaviors. We know we have a limited toolkit right now until we get that vaccine that Dr. Ludke talked about this morning. So in the interim, to the extent that each of us really pays attention to maintaining that 6 foot of distance, not hosting or attending gatherings, washing our hands and wearing a mask, those are the things that will drive our case numbers down, which then will eventually allow schools to reopen.
Commissioner Sorensen.
Thank you very much. I just wanted to mention a few things and then ask a question. Looks like the deaths in Oregon from COVID continue to go up. In May, we had 100. By June 1st, we had 200, over 200. By August, we had 350. By September 1, we had about 500. October, 550. November, 700. The estimates for January 1, 2021 are now 1,000 deaths in Oregon, according to the University of Washington. And then in terms of projections out to February 1, if there is a mask mandate, we will have only 1,400 deaths. But if we, that's if we have a mask mandate. If we don't, we'll have 2,000 deaths by February 1st. Those data all come from the University of Washington. Now, for my question, in mid-September, Dr. Anthony Fauci of the National Institutes of Health said that a national mask mandate won't work. And he clearly stated in a number of interviews that he was against a national mandate. By July, earlier, Dr. Fauci said, well, maybe at the local level, a mandate would be very important, was his language. And then in October, he said, in light of the expansion of the disease, that if people aren't wearing masks, then maybe we should be mandating it at all levels. As you know, I've been in favor of mandating masks for some time, and your department has opposed that. I'm wondering if you've given any thought to revisiting your opposition to a local mask mandate and why you haven't. Thanks a lot.
Thank you. Chair Buck, Commissioner Sorensen, I think you're mischaracterizing my position and the position of the department. I absolutely support masks, and I believe Oregon has a statewide mask mandate. So I think that's been an important part of the work that we've done statewide as a community to require masks, and that has evolved some over time, even most recently this last month, to be clear about how we need to wear masks whenever we're indoors. So I absolutely support the statewide mask mandate that Oregon has.
Well, I would just say, you know, in law, we have two fancy Latin phrases here that really apply. And one is the idea of a de jure comment as opposed to a de facto comment. In terms of a de jure comment, I don't disagree with you about what the law is or isn't. It is what it is, to quote our president. And I'm not really trying to argue about what the law is or isn't. But I do think as a de facto matter, as a matter of fact, there's really no mask mandate. I've never seen anyone being told they can't do something because they're violating a so-called state mask mandate. I don't think anybody knows that there's a mask mandate. And I would just take exception to my view that I'm asking about a mask mandate, not whether or not you think masks work. Masks do work. And the issue is, why isn't Lane County, either the Board of Commissioners, the Board of Health, or Lane County Health and Human Services, why aren't we working on a mask mandate? The numbers are going up. They'll continue to go up until we get serious about doing what we know will work, which is social distancing and mask mandates. Thank you.
Commissioner,
I'm sorry, go ahead.
I was going to call on Commissioner Murray, but if you want to respond, you can.
I think, thank you, Chair Buck and Commissioner Sorensen. And I would just say again that that certainly is an option if the board would like to pursue a local ordinance in addition to what the state law requires, then we absolutely can prepare that for you. And I know we've talked about that at other meetings.
Thank you. Commissioner Murray.
It's always hard for me not to tag on to the previous conversation, even though I did have a couple of questions. Question number one, how is our hospital capacity looking to you, Karen?
Thank you, Chair Buck and Vice Chair Berney. We have been monitoring closely the work in the hospitals, and at this point, we are averaging probably around 15 people at a time in the hospitals. As you know, people are admitted and discharged over time, and hospitals here continue to report that they have adequate capacity both in regular med-surg rooms as well as for ICUs and ventilators. So at this point, they are managing.
And is there any way to quantitatively, or is it too complex to say we have, X amount of ICU beds capacity versus the amount used? Is that an incorrect question?
Thank you, Chair Buck and Vice Chair Burney. It is not an incorrect question. And I know we have, just consulting the data that was supplied by our planning section, and it looks like in our monitoring of our HOSCAP system, this is about less than 5% of capacity that we're tapping at this point.
Okay. Well, my goodness, we're certainly in a lot better situation here, are we not, in Lane County than many areas across the country and across the state?
Yes.
Yeah. Another question regarding the change in school metrics. You've been reviewing what they are. Can you share what the thinking was behind changing them in the first place?
Thank you, Vice Chair Burney. I will do my very best. However, these have been developed by the Oregon Department of Education and the governor's office. So I may miss some of the subtleties in terms of this change. The bottom line is that there's an effort, an acknowledgement that we really know that children, and particularly younger children, are going to do better in in-person instruction. And when Oregon first established its metrics for returning to school, we were one of the first states to release specific metrics. And since that time, the science has continued to evolve, and we've had an opportunity as a state to see what's happening in other communities. And the Department of Education and the Health Authority work together to find, I would guess, a balance point that more positively allows particularly those communities where there is less disease prevalence to be able, if they have a plan, to safely bring children back into the classroom to do so. So for instance, that's why you see the elimination of the statewide metric, because there are many places in Oregon where disease levels really are relatively low, and it can be safe to bring children back into the classroom. And by making these changes, children are better able to do that. Lane County doesn't happen to be one of those at this point. So there clearly is still an acknowledgement that until disease spread is less than we have right now, it isn't safe to bring children back into the classroom, just because the virus is so prevalent. And the other part of opening schools is that when we have significant outbreaks, we will need to close those schools again. So you want to have the case numbers down low enough so that you aren't in a situation where you're rapidly having to close schools down as soon as you open them.
Thank you. Just a couple more. I'm speaking as an obsessive Duck fan now, but nonetheless, the October 29th, I believe it was, article. Gotcha, Commissioner Bozovich. The October 29th article that discussed how, and I can't wait for football season to start, but discussed how Duck athletes are getting daily rapid result testing, and then they're going to practice. And the article, I'm asking about the truth in this. The article suggested, the Ducks are getting a disproportionate amount of testing. And it's even hard for me to wonder why we can't have our children daily. Talk about Commissioner Sorensen's return on investment. Our children daily taking such a thing to accelerate the safe pace at which they can go to school, have social interactions, et cetera, et cetera. Do you have any comment on that at all?
Thank you, Vice Chair Burney. I appreciate that question because there's been a lot of conversation about antigen tests, which is what the Pac-12 is using for football players. And we recently, as a state, and then the county, received our portion of a significant number of antigen tests. And those tests really are designed to be used for people who are symptomatic. When they're used in people who are asymptomatic, they are much less accurate, particularly in terms of finding positives. So, for instance, if we use the U of O as an example, that if they have someone who comes up positive using one of those antigen tests, then they're going to go through the effort to confirm that through PCR testing to make sure it's a true positive. The tests are just much more reliable for people who are symptomatic.
No, that makes total sense. And my only other comment is, you know, it's kind of interesting. We do have a state mask mandate. In the last week, I haven't seen anyone unmasked, and I've gone a number of places. I think the population is starting. I think behavior is starting to change. And, you know, it's tough for me because I see this board has passed, and this is to Commissioner Sorensen's point, I see this board has passed other emergency mandates and emergency housing mandate, but that doesn't mean we've produced any additional housing. And it doesn't mean that we have the resources to. It's sort of a statement of values. And what I'm observing, for just anecdotally, is if you get people to choose to behave a certain way rather than demand it with enforcement behind it, sometimes that is, in this situation, it may actually be more impactful. That's what I'm seeing right now, for what it's worth. I don't think any of us are against getting rid of COVID, getting children safe, getting back to work, keeping businesses open. We're just navigating with you how to do that in the best way possible. Thank you.
Any other comments or questions? Thank you for the updated report. I'm following, the revised school metrics really closely because I want my little girl to get back into first grade as soon as possible. As soon as possible, like many parents out there. But of course, we all want our little ones to be safe and not bring any bad germs home. So appreciate the report and look forward to seeing our numbers continue to go down, even if it's slow and steady.
Thank you.
Yeah, thank you. Okay, we'll go to the holiday farm fire update, and we have Dan Hurley.
Hello, Chair Buck. Good morning, Commissioners. So I would say things are going pretty well on the fire recovery front. As systems get better stepped up, both internally and with the state, we're getting more clarity and more coordination between the different agencies. Our focus continues to be on outreach, to making sure that we are providing clear information. We're currently working on stepping up a new website. We're working with our PIO and with technology services to get a consolidated website that has more updated information that's clearer for the public to use, and will provide clarity for people who are working through the process to rebuild their homes. So land management is heavily involved to try to clarify their processes. And I think this will be a big benefit overall, just not specific to the fire, but the immediate target is just for our victims of the fire to give them that clarity. We're continuing to have our Facebook Live events. Those are every Thursday at noon, where we talk about the current information. We've been pretty focused on debris removal and clarifying with people how that process will work. And we bring in different representatives from the community to give updates. On the social services front, you got to hear from Lucy Zamarilli this morning. She's doing a terrific job continuing our outreach. Our focus is now moving up the valley. So Thursdays and Fridays, she's up there, Thursdays in Leesburg, and then Fridays in the upper McKenzie Valley. And then Laurel O'Rourke is doing a terrific job doing case management, primarily for our folks who are housed in emergency hotel sheltering through the Red Cross. Things with the Red Cross have improved somewhat. We had some challenges over the previous week as Red Cross sort of purged their lists and exited. We're not sure the numbers. We're not being provided with the numbers, but probably in the range of 100 to 150 people that were taken off housing sheltering for folks that they felt didn't meet the criteria. And that was very frustrating working through that. I had a lengthy conversation with the regional CEO, Dale Kuntz. And at the end of that was actually still pretty frustrated that it didn't feel like we had made progress on improving communications. Red Cross will not share any data on their clients with us until there's an agreement with the state. And we are told that that's forthcoming. but it's been in the works for a long time now, and we're almost at 2 months into this, so that's getting pretty frustrating. I have arranged for Mr. Kuntz to speak with you next week. He will be with me when we do this update to the board, and you can ask him some direct questions. But he did put us in touch with someone who was quite helpful over the last several days, Mr. Chad Whitaker, who's their operations section chief, although he's going to be leaving, I think, tomorrow, and we'll have a replacement there. But he has been helpful as we've had cases where we know that the person meets the criteria, and Laurel's working with the person, and we've been able to get a few people back into shelter by doing that work and providing documentation as necessary. I don't have good numbers for how many people we have in shelters now and in the hotels. They were in 12 different hotels, and Red Cross was consolidating down to 3. But that caused significant disruption that was happening across the state at the different counties that have been affected by these disasters. Red Cross put a halt to that, and I'm not certain where we are in that process, but hopefully we'll have an update by next week on that. On the disaster housing, you got to hear a good update on that from Austin last week, so I'll kind of skim over that. But I will say that we are working to put together a tiny home builders group that could potentially build tiny homes if we can identify sites for those to be placed either on private properties or if the county's able to purchase a property for that purpose. So we're working through those plans. On the debris management effort, Jeff Bishop has done a terrific job leading this and in conjunction with DEQ. And we feel like we've been able to answer a lot of the questions that property owners had around what structures can stay and insurance issues. And pretty pleased with where we landed with the right of entry submissions, which will allow the EPA to move forward as they're doing right now on the hazardous waste cleanup part. We received over 474 submissions, and the majority of those signed up for both phases of the effort. The first phase, which is currently ongoing with a couple teams from EPA, that'll step up to 4 teams as the work in Jackson County finishes up, and that work will continue for the next few weeks. We're still waiting on timing details for the second phase, which will be the ash and debris, but we have heard good news that the state is going to pick up the 25% cost share, that 75% will be covered by FEMA, 25% will be covered by the state for that second phase. So that's good news to property owners and for the county to not have to pick up that part. The watershed work for erosion control and soil stability and pulling hazardous waste on priority properties away from the river is going really well with eWeb. They're working with multiple properties. They have a map that's set up, a dashboard that shows they have about 160 properties that they're prioritizing, and they're probably about 2/3 of the way through that work. I think that covers most of the things I wanted to cover for you. I wanted to keep this fairly short, subject to your questions. That concludes my briefing.
Thank you. Any questions or comments? And Commissioner Farr.
Just to say this, Chair Buck, that looking at tomorrow's agenda, many of the questions that I might have today should be covered in tomorrow's agenda. Looking forward to that, Dan. Thank you.
Any other comments, questions? Commissioner Burney.
Thank you, Dan. Just 2 quickies. Have you had the chance yet to look at the new Springfield ordinance in that regard that we were discussing last week?
I have, very excited about that, and I'm hoping that that can be one of our solutions to start getting people housed into potentially tiny homes on or some sort of modular structure on private residences where that can work. So that's very exciting to see.
With your permission, I will share that with the City Council. And I just a quick heads up. I've been super impressed with what I've learned that, in terms of the Northwest Youth Corps chipping in, and yes. And I know that they're going to soon be knocking on your door and saying, how can we help? We want to help. We want to use this to recruit more young people into this kind of an activity. We're going to use this to raise private money to support those young people. So just a heads up, because I see that as a valuable resource that you would know how to integrate in far better than I.
Great. Yes, they approached us earlier on, but we didn't have projects lined up in the timing that they needed. But I'm glad they were able to partner with UWeb, and they're doing some great work out there right now.
Any other questions or comments? All right, I'll just share a few things that I've been working on since our last update too. Couple more trips up the river, of course. One trip to make sure that our senator's staff knew what was going on. Looks different every single day that you go up there, depending on what activity is happening. I did see 2 new houses being built and a ton of tree work happening. I saw the youth corps at the Upper McKenzie Community Center all come in. They were pretty excited to do some work and they were ready to go. So I look forward to seeing them get in there and do some good work for the community. Also stopped by the Leesburg McKenzie Fire Building, where we had Steve McGuire, the planner up there, who was working on getting RV permits. That is really popular. Got through a lot of permits and scheduled appointments for more, in a wonderful way to make sure that people are housed and back on their property as soon as possible. So just appreciate having him up there. The whole community has been talking about it, how helpful it is to have some of our staff upriver, even if it's not fully all the way upriver, but closer than coming all the way into town. You know, gas isn't cheap, so the less running around they can do, the better. And so that was really good for our center staff to see what activity we were doing up there too. It's become a really good hub. And I know that there's the Leesburg, the old Leesburg hatchery is going to be another good hub. And lastly, you know, I've been participating in the Wildfire Economic Council that's ran by Tobias Reed and Val Hoyle, and has members, Commissioner Murray and I have been attending those meetings as local members. And so we've been continuing to give some feedback to the state, also working on how we can utilize the mobile home parks and models for housing to get these people rehoused as soon as possible. Of course, a passion of mine. We didn't have as many mobile home parks go down as Jackson County did, but nonetheless, we have a few in McKenzie that we need to pay attention to. So trying to figure out resources there. I hope we can go in that direction for some additional funding for housing upriver. So with that, if there are no other comments or questions, we'll move on to the consent calendar. Thank you for the update, Dan. Is there a motion to approve the consent calendar?
So moved.
Second.
Moved by Commissioner Burney, second by Commissioner Bozovich. There's somebody still not muted there. So motion by Commissioner Burney, second by Commissioner Bozovich. Any discussion? I see none. I'll call for the vote. All those in favor, please say aye.
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 All those opposed say nay. Motion passes unanimously. Thank you. Okay, we'll move on to item 8, which is Health and Human Services Order 20-11-03-03 in the matter of approving 2 contract amendments with St. Vincent de Paul and delegating authority to the county administrator to sign the approved amendments. And at this point, I'm going to declare a conflict of interest as I'm related to the executive director of St. Vincent de Paul. I'm going to hand a proverbial gavel over to Vice Chair Burney, and I will turn off my camera and my audio for this item.
I'm always appreciative when Heather does that, because I'm nervous if the chair's watching me attempt to chair a meeting. Item 8, Health and Human Services Order 20-11-03-03 in the matter of approving 2 contract amendments with St. Vincent de Paul and delegating authority to the county administrator to sign the approved amendments. And I believe we have someone new to talk with us, Karen Gaffney.
Hello, commissioners, me again. Yes, this item is fairly straightforward and routine. There are 2 specific contract amendments we are requesting delegated authority for to increase the ability for rent relief services that are managed on our behalf by St. Vincent de Paul to provide additional resources to them. Again, these are funds that come to the county as part of the COVID rental relief, and we move those out to nonprofits in the community to distribute those on our behalf. And this is not on the consent calendar today, not because it's not routine, but because of wanting the ability to have a separate vote given Chair Buck's conflict. So that is this item. I'm happy to answer questions, but it's fairly routine.
So I will call for questions, comments, and I see Commissioner Sorensen's hand up.
Thanks so much. I'd like to make a motion to approve the order as presented.
Is there a second?
Second.
It's been moved and seconded. Is there further discussion, comments, questions? Commissioner Bozievich.
Thank you. I just wanted to ask real quick. I see our current authorization for these 2 contracts is somewhere in the range of $3 million. This is adding $7 million to those contracts for rent relief. The source of funds on this is the federal bills and coming down through the state finally on the COVID relief funds.
Thank you, Vice Chair Bernie and Commissioner Bozievich. Yes, the source of funding is the federal funding. And what I will say is that with many of these contracts, we authorize a larger amount so that we don't have to amend the contract each time dollars come through. So this gives us delegated authority to continue to increase dollars to those particular vendors as additional federal funding becomes available.
So a little follow-up then. My understanding is the way the state's dealing with the CARES Act COVID relief funds is we're having to put the money out first and then they're reimbursing us. Is that the case here? And what is our original source of that funding, out of reserves to upfront this?
Thank you, Commissioner Bozievich, for asking that question. On the rental relief dollars, I believe a portion of that actually might not have been reimbursed. This is not through the general CARES Act process that the county is going through, but this is through money that was allocated to Oregon Housing and Community Services and then has come down to us through a separate contract. So on that, if in fact, to the extent that we are needing to get reimbursement, we would treat that the same as we do actually for a number of our grants that are reimbursement based. And we do have reserves in our fund that allow for cash flow for us to be able to expend those dollars and then build a funding source and get reimbursed.
Thank you. I just wish we were like Portland and Washington County, where we got the funding directly without having to be upfront stuff, and it would have been far more than $7 million available to us for rent relief if we had gotten the same per capita funding that Portland and Washington County got. Thank you.
Any other comments? If not, could someone call the question? Or do I do that?
You can do that.
Okay, I will call the question. All those in favor of approving order 20-11, I'm hearing an echo, but whatever. 20-11-03-03 in the matter of approving 2 contract amendments with St. Vincent de Paul and delegating authority to the county administrator to sign the approved amendments, please signify by saying aye.
Aye.
Opposed? Same sign. Hearing none, that is 4 commissioners aye, none nay, with Commissioner Buck not voting. Okay, and magically, I shall now pass the gavel to our chair.
And if on that last vote, it could mark myself as recused, I'd appreciate that.
I apologize, Chair. I'm going to write that word down for future reference.
Okay, we'll move on to item 9, County Council announcements. Mr. Dingle.
No announcements, Chair.
Okay, we'll go to County Administration. The next item is a report from Travel County, and this is a follow-up to your first half of your report a couple of weeks ago. We're sorry the technology wasn't working at the time, but we want to make sure we got you back so you can finish up your report for us. Carrie Westland.
Chairman Buck and commissioners, thank you very much for the opportunity to come back and just button up our annual report to you. The silver lining of the disaster of a couple of weeks ago was we found an internal technology glitch, so we got that fixed up, and so we'll take that as a positive. I have just a few additional updates that I think will be relevant for you, and then I will be asking you to consider extending our formal grant agreement by 1 year, as has become our practice each year when we provide our annual report. So first, I just want to report out that we did have a clean audit presented to our board for acceptance, and that will be submitted to Lane County shortly in conformance with our formal grant agreement with you. And I wanted to just run through a quick overview of the status of the industry so you have a sense of what is happening with the hospitality industry in Lane County. Quick overview of the summer. We had variable conditions throughout Lane County. Our small rural communities that are very individual vacation traveler oriented had summers that were in some cases near normal. So Florence occupancies and hotel revenues were actually pretty close to normal. The McKenzie River Corridor performed well, other parts of rural Lane County. Our food and beverage sector, because of limitations on in-restaurant dining, had their challenges, but they rallied and they worked with communities on things like streeteries and got through the summer. The metro area is a little bit of an anomaly, as some of you have heard me say in presentations. We have a lot of mass gathering demand generators in the metro area. So convention traffic, sports events, performing arts, large festivals, those are all important to the metro areas throughout Oregon. And our metro area performed at about 65% of typical summer patterns. So not as devastating as we had originally projected. And we're thankful for that, but not near normal. Year to date, countywide, through September, our hotel revenues are off about 35% in total, which, just to give you a frame of reference, represents about $45.5 million in commercial lodging revenue. And it represents about $278 million in direct visitor spending. So that's the relationship between accommodations revenue and direct visitor spending in Lane County. So there are some significant economic impacts that we are feeling due to the COVID pandemic. The McKenzie fire situation is, of course, devastating for a large area of Lane County. It did have sort of a reverse effect during the month of September and into October, in that wildfire evacuees, as you know, were in area hotels. So our occupancy numbers in hotels were up higher than they would have been. Although revenues were certainly low, because those evacuee rooms, working with the Red Cross, are at reduced rates. But it's one of those anomalies. We had an emergency on top of an emergency, and they sort of counterbalanced each other for about a month. We are currently working along the McKenzie River Corridor with other community partners, taking an inventory of the hospitality businesses. Conditions are variable along the corridor. Some businesses were lost. Some are really open and operating almost as normal, other than the impacts along the length of the corridor. So we're trying to get a handle on that so that we are messaging appropriately. We're sensitive to the fact that the corridor isn't really set up for large scale traffic. And at the same time, we have some operating businesses who are looking for cash flow and are looking for customers. And so we're trying to be sensitive about how we manage those communications so that we are assisting those businesses that are open and ready for customers and not negatively impacting the corridor as emergency crews are working on cleanup. You all are very well aware that the hotel community really leaned in around housing evacuees. I think we've got some work underway with public health around quarantine rooms as well. And I just really want to give a shout out to our area hotels and our restaurants who did a lot of feeding of fire crews. And it's been a real community effort on behalf of the hospitality industry. I wanted to let you know that I heard Commissioner Burney say that he donated blood today. We are doing some support of Lane Blood Works with our hashtag Love Lane work and making sure that the public kind of knows where to access Lane Blood Works, and hotels have set up areas for blood donations over the last several months. And then also being sensitive to the COVID-19 update that you have received, we are working with area hotels and restaurants on kind of a deals for locals scenario, so that residents who have incoming friends and relatives traveling to the area to celebrate the holidays have some opportunities to reduce those social gatherings, and particularly in kitchen extended hour gatherings. So we're gathering up specials for hotel stays for visiting friends and relatives and takeout food, just to try and help people reduce their risks as much as possible and maintain sensitivity heading into the holidays that we're really trying to avoid close gatherings for long periods of time. Looking ahead, we remain concerned about the mass gathering limitations and the economic impacts that will have, recognizing that those limitations are necessary for public health. We are concerned about economic revenues coming into hospitality over the next several months. And we're talking with legislators about the protocols around mass gatherings, because they are sort of a blanket approach, no matter what size a venue is, how many separated rooms it might have. Right now, the guidelines from the state have mass gathering limitations that are really per building. And we're asking for some review of some of those guidelines so that those venues that have multiple rooms, multiple spaces, there might be some accommodations made for socially distanced gatherings in spaces that can accommodate those. So we'll see what comes of those discussions. We are projecting the year ahead, or the year that we're in actually, fiscal year 21, to be down about 31% from a typical year in terms of overall accommodations revenues. And we're really holding our breath around spring to see what happens with Hayward Field and the reopening of that facility, and whether we're able to resume some very strong activities at the end of this year based on availability of vaccines and all the things that you're tracking as part of your public health updates. We're also continuing to work on local staycation ideas, schoolcation ideas, and workcation ideas as people are looking to get themselves and their kids out of their houses a little bit, finding safe ways that people can be engaged in constructive activities that also supports local businesses. And then I wanted to just finish up with a little bit of a silver lining reminder that in spite of the amazing things that we are all experiencing together, there have been some real bright spots over this year, and there will be in the future as well. I just want to remind the commission and the public that we had Civic Park open. The kids sports facility is open. That's a fabulous new facility. The 5th Street Market expansion will be opening soon. The addition of the Gordon Hotel, the True by Hilton property opened in Glenwood. The Best Western Green Tree has an expansion underway right now. I'm watching the Riverfront Park work come to life as I'm out on my runs around the bike paths. The McKenzie River Discovery Center is that project that's still planning to move forward. We're very thankful. I think they lost one building on that campus. It's on your property. But that group is still working hard to bring the McKenzie River Discovery Center to life. We're continuing to work on the indoor track concept with the Springfield Community Development Corporation, the City of Springfield, Lane County staff, looking to scope that project so we can bring it to the public for consideration. And we're really interested in possibly positioning that project on the transfer site. It makes it a longer term project, but we would like to take a look at that and see how that project might come together with the timelines that you have around the transfer site and bring it back to you for some consideration on that site. We've seen some real interest from the hotel community around the indoor track project because of the room demand that it will generate, and particularly at a typically very slow time of year. And then the flexibility of that center too. I think we may find that the hotel community is interested in assisting with some of the funding of that project that might really help us start to cement the project and get it fully designed and available for people to look at and evaluate. So I'm hoping that you're feeling good about that work. You've been very helpful up to this point. You helped to fund some of the very early feasibility of that project that kind of proves out its viability in terms of room demand generation and feasibility in terms of how the building will perform. And so we're continuing to iterate that work, and just want to kind of keep you aware that it's in progress, and allow you to express any support you want to, or concerns that you might have, so that we're keeping those well in hand. And then finally, I just would like to request a one-year extension to our formal grant agreement with Lane County. As a reminder, it's a rolling grant agreement. It never is any longer than 3 years in length. And each year when I come before you to present out our annual report, you consider a request for a one-year extension. At this point, that would be bringing us to about a 2.5-year agreement cycle, because we're already in several months into this current fiscal year. So I'm happy to answer any questions that you might have, and I really appreciate the opportunity to come back and kind of finish up my report to you.
Thank you. Commissioner Farr.
Thank you, Chair Buck, and thank you, Carrie, for a great presentation. There's no way you can cover all the things you could be covering, should be covering in this brief period of time, and thanks for keeping it as short as possible. However, I'm eager to hear more. I do have a question, Chair Buck, and this is for staff. In order to grant the one-year extension, do we need an order for that, or can it be done by a simple motion at this meeting?
I've got information that can be by a motion to direct staff to prepare an order for consent for additional year. So it could be put on our consent calendar for our next meeting.
Then I am prepared to make that motion when it is appropriate, Chair Buck, and I'll defer to other commissioners for comment.
I was getting ready to second it, but it wasn't made.
Commissioner Sorensen.
Thanks very much. Thanks very much, Carrie, for the, as usual, excellent report. And I, along with Commissioner Burney, would be willing to move this forward by having a motion to direct staff to prepare the order. I don't think that we should make that action final today, but I do think that the order should be examined by legal counsel before it goes on the consent calendar. But I think that's a great way to go, and I'll just defer to Commissioner Farr to make that motion.
Commissioner Farr.
Chair Buck, then you read the appropriate wording for the motion. I would like to make the motion in the wording that you stated previously.
And I would, with Commissioner Sorensen's okay, I would like to second the motion in the wording that Commissioner Buck stated previously.
All right, I'll repeat the motion, make sure everybody's on the same page. So this is, we have a motion on the table to direct staff to prepare an order for the consent calendar at our next meeting it should be our next meeting. That extends the grant with Travel Lane County, excuse me, for 1 year. Any discussion, Commissioner Sorensen?
Yeah, I think that in the past, the legal people have wanted to review the memo and the proposed order. And assuming they can do that in a week, then I would assume we could go ahead and approve the motion as made. But if they need more time, I guess I would just say it's my view, more time should be taken before they write up the documents that we need. And I'm sure Ms. Westland can help the legal people and any other county people that are involved in this. Thank you.
Thank you.
And Chair Buck, I believe that is inherent in the motion that we would ask staff to prepare. So thank you.
Right, it's standard practice that legal reviews it before it goes on our consent calendar. Any other discussion? Commissioner Buck.
I just want to say I'll be supporting the motion. Carrie, you and your staff have done a great job in a very unusual year, from dealing with COVID to dealing with the fires and the way the travel industry in general has stepped up and helped out in both cases in providing our ability to isolate people from COVID to housing fire victims, I think is just commendable. I will say I do agree with you about the Florence area not really having a downtick. I tried to book space at Darling's Resort, and I had to go like 3 months out to just a couple weekends ago. You know, back in June, I tried to book something and ended up booking it in October because that's how hard it is to get a space there. So there is a lot of people that are local vacationing, like I am, and what I refer to as my COVID capsule, because you know the Airstream is self-contained and looks like a capsule. So it's really kind of interesting how this has all gone, and I do continue to support your efforts to site the track at the transfer station. I think ultimately that's the best place for it, rather than taking up valuable street frontage on a very busy street. We've talked about that in the past. And I do believe we are going to be moving that transfer station out to Short Mountain eventually, especially if we get a commingled recycling facility there that Vice Chair Burney would like to have as part of that transfer station in the same location. And I really do look forward to next year as Operation Warp Speed, as Dr. Ludke discussed with us this morning, has multiple vendors preparing vaccines at this time in mass, so that they'll roll out very quickly. And I think he was talking about by the second quarter, we'll be down to the third or fourth tier of vaccines where our kids will start getting the vaccines. So hopefully by, not too far into spring next year, some of those mass gathering restrictions may be coming off. And particularly as I'm hoping folks, we've seen a change in behavior here locally where we've started to get our local surge of this wave under control again. Our case counts are starting to drop again. Our number of infectious cases are dropping. So I would encourage people not to give up on wearing their masks, to keep up those behaviors, because it really, if we can keep our numbers down here in Lane County, that's more ammunition for us to bring to the legislature around those mass gathering restrictions. So just great work. I really appreciate the report. We kind of didn't get to say much last time because we had the technology break up. So this was just my opportunity to say, you guys are doing a great job.
Thank you.
Commissioner Burney.
I would like to echo Commissioner Vozovich's remarks to you, Carrie. I think that on a day which has a very contentious national election, I think the stability of our ability as a community to move forward rests with people such as yourself that are navigating, obviously an advocate for an industry, but also an advocate for the communities that those industries are located in. And I've never heard you suggest you have the answer, but I've always heard you want to contribute to the solution. So I think you get a sense of maybe some of the long-term projects you and I have discussed and the sentiments on this board. And I think you have a sense of our appreciation for the partnership. And I just wanted to say those comments too, because the last time you were here, it got a bit garbled. So thank you very much.
Thank you.
Commissioner Farr. We need your audio.
Thank you. Only for this, Chair Buck. Thank you. To give a call out to your board of directors, Carrie, particularly two of them. I'd like to call out to Pam White, who's been your treasurer for all of these years, and to Dana Terrell, who does such a superb job in helping with the marketing element of Travel Lane County. Great board of directors.
Thank you.
Any other comments or questions? I don't see any.
Chairman Buck, if I might, I just want to thank Commissioner Sorensen, who has served on the commission for so many years. You know, I've been here I've been at Travel Lane County even longer than Commissioner Sorensen has been on the Board of County Commissioners, but I just want to thank him for his support and service over these many years, and really thank all of you for your support of this important industry sector. And I appreciate our relationship with you so much and your individual demeanor in how you work with Travel Lane County, and just want to say thank you, as well as to acknowledge the work of yourselves and your staff team over this last 10-month period. It's been phenomenal to watch Lane County in action, and I'm really proud of Lane County. So thank you very much.
We definitely appreciate your work as well, even through really, really tough times for your industry. So we have a motion on the floor. Is there any other discussion? I don't see any, so I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. Aye.
Aye. All opposed, say nay. Motion passes unanimously. Thank you. Glad we could have you back to finish this one up.
Thank you so much.
We'll move on to county administration announcements.
Thank you, Chair and Commissioners. And I can't see on my screen, but I believe Greg Rickoff, our Director of Operations, as well as Sheriff Cliff Harold are on as well. And what I wanted to do right now is provide an elections update. And I asked Mr. Rickoff, who oversees our Lane County elections division, and the sheriff to join just to talk a little bit about our elections process, and particularly questions about security and accessibility and that have come up more recently. So I'll provide just a brief overview and a few comments, and then I think I'll ask Mr. Rickoff to add to that, and then the sheriff to touch on coordination of law enforcement locally in our efforts to ensure a safe, accessible, and fair election. So as of yesterday, as the board knows, Lane County voter registration is 273,954. Ballots received through yesterday, Monday, November 2nd, were 200,751. That's a 73.28% return. That's compared, so 200,751 compared to 2016, the same time, the Monday, day before election, was 138,081. So over 62,000 more votes as of the same period of time compared to 2016. Really great, because of course what we all want to see is 100% voter turnout. We want everyone to have the ability to exercise their democratic right to vote. Ballots must be received at an official Dropbox site, one of our 20 Dropbox sites, by 8 p.m. Not 8:05, not 8:04, not 8:03, not 8:02, not 8:01, 8 p.m. tonight. You have to have your ballot turned in. Too late for it to be mailed in, obviously. Have to have it turned into one of our official Dropbox sites. Any concerns, and the sheriff can expand on this, any concerns with voter intimidation or blocking of access to any official Dropbox site should be immediately reported to law enforcement. We've done great work in coordination with local law enforcement throughout Lane County to ensure the security of our ballot drop boxes, and we have security plans in place. We don't talk about them for obvious reasons, but we do have really thorough and robust security plans in place that are reviewed by the Secretary of State's office. We also want to remind voters are reminded to get their ballot in early. Don't wait till the last minute to vote, because you got to get it in there by 8 o'clock. Our call volume remains high, so please allow for time if you're calling or stopping by Lane County elections. The election results will be posted at 8 p.m. tonight. It's one of the great things about our election system in Oregon is that because we've been doing this for 25 years and 73.28% of the ballots were cast yesterday, and many of them will come in this morning. Our election staff is able to count those and then release a significant portion of the votes right at 8 o'clock tonight. We'll also release results at 10 p.m. And when our staff leaves for the night. And then we expect to provide updated results tomorrow, Wednesday, November 4th by 5 p.m. as well. We're working in coordination with our local media. Devin Ashbridge and Cheryl Betchart are coordinating that activity to make sure that local media has the information that they need. The election will be certified in Lane County no later than Monday, November 23rd, and results are unofficial until then. Finally, before I turn it over to Ms. Rickoff, just want to reassure folks that elections in Oregon are secure. There are multiple layers of defense controls, both hardware and software, designed to prevent interference and tampering. At the state level, there are preventative and detection measures built into the systems used across Oregon. Some of those include continuous monitoring, firewalls, third-party testing, inspection of encrypted traffic, multi-factor authentication, and more. At Lane County elections specifically, we help protect the integrity of your vote in several ways. One especially important tactic that we use is that we do not connect any of our voting systems to the internet. They're closed systems. And we only transmit election results via a closed platform directly to the Oregon Secretary of State's office at specific intervals. We have robust security plans to ensure that every vote counts. Our plans are reviewed, as I mentioned, by the Oregon Secretary of State. We have and continue to coordinate with local law enforcement who are great partners in ensuring election security. We want to particularly thank the Lane County Sheriff's Office for providing security at our elections office. And you can learn more about election security in Oregon if you visit sos.oregon.gov/elections. And you can find that information there. And then for questions regarding voter registration or elections in Lane County, visit lanecounty.org/elections. You can call Lane County Elections at 541-682-4234. The final thing I'll note here is the sheriff just forwarded to me, and I forwarded to the commissioners, a response letter from the Oregon Attorney General. So you have that in your inbox if you want to pull that up. This is in response to the incident that was reported in Springfield on Sunday. And so the Oregon Attorney General did look into that issue and has provided a response to those who submitted the complaint. And you can see more information about that. So just wanted to, the board saw some email communication that came through on that incident, and local law enforcement and state law enforcement have been on top of that issue, investigating and looking into it, and you have information there. So I want to turn it over to Mr. Rickoff to fill in any holes that I left, and then to the sheriff to talk specifically about law enforcement coordination for the election.
Chair Buck, commissioners, thank you. Mr. Mokrohysky. The only things I think I would add would be, as Mr. Mokrohysky shared with you, the numbers that we've had over 200,000 votes already sent into the office. The entire election in 2016, we received 191,000 returned ballots. So what we received at the end of the day yesterday already exceeded our 2016 numbers. So those are fairly significant. We do expect to have a very large day today, which is normally the case. It really is a pretty remarkable team. I know you've all had a chance to work with Cheryl Betchart, our Lane County clerk. She really is a tremendous individual with a wealth of experience and expertise, and really one of the state leaders when it comes to election services. They have a tremendous plan, a remarkable staff. We moved from 4 full-time FTE in elections to 154 full-time FTE during the election season. So they're bringing on a lot of people, but do note that these folks have a tendency to return year after year. Quite a number of our election staff started out as observers. Were folks who were originally a little bit skeptical about the voting system, wanted to see for themselves. And once they had a chance to observe the elections, they decided they wanted in, and have since then, some folks have worked up to 10, 15 years on elections because they see a process that they can trust, that they can respect, and that they want to be a part of. So it's a pretty remarkable team. They will have a long day today, and they've had a fairly long week to begin with, but everything is going smoothly, and ballots are continuing to come through the door. We'll get the numbers out. As Steve said, we will have the initial tabulation of those 200,000 ballots, plus whatever they get in by noon today. Those numbers will be reflected in the 8 p.m. numbers that you see come out, and then the rest of the ballots will be counted. Once all of the signatures have been verified and the votes can be tabulated, they will do that, and those numbers will be out later tonight or tomorrow.
Sheriff, did you want to add anything before I go to questions?
Sure, I'll just share a little bit about preparation. About 3 weeks ago, Lane County Clerk Cheryl Betchart and I had a meeting and sort of an initial discussion about things, and then I helped her host a meeting with all of the chiefs of police and local law enforcement heads. We've actually had 2 of those the last 2 Fridays, where we were all able to get together and have a conversation. Cheryl did a really good job of providing information at the fingertips of folks that would be available to go out, say to a patrol briefing. A sergeant could hand them out to their shift briefing, so that at their fingertips they have the appropriate ORS statutes, et cetera, that might be applicable. And a request to do, some rolling checks of ballot box drop-off areas to keep an eye, make sure that nothing untoward is happening. And so had a really good opportunity for everybody to touch base on that. And then we've actually had a 3rd meeting since then as well to discuss potential post-election concerns, if there are to be any public safety concerns post-election. We all had a conversation about what plans or preparations we've made. If we need to ask each other for help under our mutual aid agreements, what type of help we would ask each other for, et cetera. So as an example, City of Eugene has a robust plan for this week, and if they ended up needing assistance from either the sheriff's office or say the Springfield Police Department, they were confident that the type of assistance they would ask for, simply be to take their normal calls for service while they dealt with whatever unusual event was happening. So some of our smaller municipal police chiefs participated as well, and so we're all on the same page and had a good conversation about being able to support each other appropriately if the need arises in the days to come. I'll probably just stop there, but be available for questions if anybody has any.
Thank you. I saw Commissioner Sorensen up.
Well, first of all, thank you so much to all of you for your work on preparing for this election. I have several questions, and the first would be to Sheriff Harold. First of all, thank you so much for being so responsive to constituent inquiries that I've had about the role of Lane County Sheriff and Sheriff's deputies in preserving the peace involving this election. Secondly, I wanted to ask you a question about the mutual aid agreements with the cities. Do you have mutual aid agreements with all the cities? And specifically with regard to Eugene and Springfield, if there is a need for mutual aid to be initiated, do they pay us for that, or do we do that in kind of a volunteer basis, and then they somehow pay us back by helping us in the future in some down the road means? Or how does that really work as a practical matter? What is the agreement in the mutual aid agreement?
Yeah, there is no exchange of funds. It truly is helping each other out, and really it's just the only way we can function. Here just a few weeks ago, my office was able to provide 7,400 hours of law enforcement presence to the McKenzie River Valley with the help of 20 different law enforcement agencies that sent us deputies from around the state, city of Eugene and Springfield. All of the local municipalities sent us folks up there, and they didn't send me a bill. Some of them will take advantage, if they can, of FEMA reimbursement to whatever level they can. But ultimately, the relationships around here are such that we really rely on each other on quite a regular basis for day-to-day calls for service and public safety needs. Sometimes the events are, not day-to-day. They're unusual historic events like the fire, but that's the way it works. And the relationships, I think, in our county are, and I've heard from folks from outside of our area, the relationships we have with each other are just top-notch, and maybe not even seen in many other places of the country. So thankful.
Okay, well, thank you very much, and keep up your good work. And on to Mr. Rickoff, I'd like to know, you said if there's any problems with ballot boxes to call law enforcement, and that's my summary of what you said. On the ballot boxes themselves, there's a phone number for people to call if there's a problem at that ballot box. Is that the same phone number on each ballot box? And is that a cell phone, or what's the status of that? And is that on the elections office website?
Chair Buck, Commissioner Sorensen, very good question. That is the office number for elections. That does roll over to cell phones so that we can guarantee that those will be answered. The pickup teams, and of course, there's never any single individual that's handling ballots. They're always handled by at least two individuals from two different political parties, but they carry with them a number of cell phone numbers, but the numbers on the ballot boxes themselves rings to the office and rings through until that phone is answered. So folks will not get a recorded message. They will get a person, as long as the hours are reasonable. If someone were to do that at 3 or 4 a.m. this morning, they probably would get a recording. But during the working hours and well into the evening, probably till close to midnight, they will get a live response from staff.
Okay, is it on the website?
Yes, sir, it is.
All right, and you know, thanks so much. This is really a phenomenal effort, Mr. Rickoff, and I know you're not the only person that is involved in the election process, but I really appreciate it. And last but not least, is there a debriefing on an election of this magnitude of the voter turnout that we're expecting? What does that debrief look like in your office or the elections office or the clerk's office, or when it's all done in November and the election certified by November 22? I guess that was the date, November 22 or 23, 22. Do you have a debrief process?
Chair Buck, Commissioner Sorensen, yes, indeed we do. We have multiple debrief processes. There will be a work within the team itself within Lane County Elections that will be run by the county clerk, but there will be a statewide debrief as well. The Secretary of State's office will bring together the county clerks from across the state to reflect on what they've learned, what they can do to improve, and it's a pretty robust process, and we see the advances with every significant election. We see the work developing, but there will be a local debrief and response as well as a statewide debrief.
Thank you so much.
Commissioner Burney.
Well, first I want to say I'm thankful to be voting in Lane County in Oregon. It really does seem as if this is one of the easiest and safest places to vote from what I'm hearing, right? I mean, on national media. I also want to call out Chief Harold. I've not been.
You froze on us, Commissioner.
That's because he called the sheriff chief.
Well, let's give him just a second to see if his computer will come back to us here. Is there somebody else that might want to speak until we get him back? Commissioner Bozovich?
Thank you, and I'll cede to Joe if he comes back. I just first wanted to say I dropped my ballots off last Friday with Elizabeth at 10th and Lincoln there, and I just want to thank EPD for their cooperation. I noticed that their mobile camera trailer was there next to the ballot box, practically, maintaining video surveillance of the area. Making it an extremely safe place to be casting your ballot. And in addition, also maintaining some additional video surveillance at the outside of our elections office. So I really want to appreciate EPD for their cooperation in helping us with this security during this election. I also want to note for everybody that almost all of our drop box locations, not everyone, but most of them, are located in conjunction with police departments. In particular, the drop box in Florence is at the police department. The drop box in Veneta is at City Hall, where the sheriff's substation is. The drop box in Junction City is at the library across the street from the police station. It is the Oak Ridge Police Station, So multiple locations, our drop boxes are co-located very close to law enforcement. So folks should not feel unsafe casting their ballots today. And I hope everybody will get out and complete their franchise and cast their ballot and have a safe day. Thank you.
Any other comments? All right, unfortunately, Commissioner Burney seems to have dropped off. So if he comes back, we'll give him the first opportunity to speak. Any other announcements for today?
I don't, unless you have questions for me.
Any final questions? Doesn't look like it. Okay, we'll move on to commissioners' business and commissioner announcements. Anything to share? Doesn't look like it. Okay. Future board assignment requests. Now, we still have 19 requests that seem to be ever revolving. Does anybody want to add to that list? I see a nose. Okay, very good. Review of assignments, which I think is limited.
I have one assignment here, and that is everyone is supposed to vote. So if everybody in Lane County votes, then we will have completed that assignment.
Very good. We do not have an executive session for today. Is there any other business for today? I see none other than vote. Get out there and vote. All right. Thank you, everybody. Have a wonderful election night. And we are in recess until tomorrow morning at 9 a.m. Same place. See you then.